I don't see Christy yet.
I'm watching for her. Okay, well, it's 6:30, so let's go ahead and get the meeting started. I'd like to welcome everybody who is attending this January 19th, 2021 meeting of the Salt Lake City School District Board of Education. Welcome. We're grateful to you for being here. Welcome to Superintendent Madden, to Business Administrator Kersley, and to board members for participating. I'd also like to take a minute to welcome our association representatives. Representing SLCSD, we have Nicole Palmer. From SLEA, James Tobler. Representing transportation is Ben Rowley. B. Alonzo with child nutrition, welcome. Eric Adams from buildings and grounds, and Cindy Mills representing SLEOPA. We'd also like to welcome members of the superintendent's cabinet and district employees who'll be participating in this meeting. We're happy to have you with us and grateful for your expertise in these discussions. We'd also like to welcome all community members who are watching via the YouTube live stream of the meeting. Will you please join me as we begin the meeting with by repeating the Pledge of Allegiance after me? Please stand. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Can I interrupt just one sec? Sam, we're up, right?
Yes.
Yeah, okay, thank you.
I'm still seeing that we don't yet have board member Sweat present, and I'm reluctant to proceed with the consent agenda without her. Let's give her a couple of more minutes to join us.
Sam, I just got a text from someone that said they can't see us. A teacher that I know. They said they can hear us but can't see us.
Let's take a minute to figure that out. Larry, I think Christy's in the waiting room.
I just let her in. Yep.
Okay. Okay, Catherine says she's gotten a text from a constituent that says they can see us.
Yeah, and I just got one from James Tobler that says the same.
Okay. All right. Let's go ahead now with our consent agenda. So I will take a motion on the consent agenda.
I move that we accept the consent agenda as written for our January 19th, 2021 meeting, including number 1, purchasing account reports, A, purchasing report, B, purchasing report Excel format, and 2, energy service company contract.
Do I have a second?
I second that.
Okay, we have a motion to approve the consent agenda and a second? Any discussion? Okay, seeing none, let's go ahead and vote on the consent agenda. Starting with you, Hoeli.
Jorge, yes.
Jenny, yes.
Kathleen Kennedy, yes.
Nate Salazar, yes.
Mohammed, yes.
Melissa Ford, yes.
Christy Sweat, yes.
Okay, thank you. With that approves the consent agenda, and we will move to the request to speak. Superintendent?
Okay, first speaker is Jamie Slack. I'm letting her in now. Jamie, can you hear us? Can you hear us, Jamie? I see the name, but I don't see. Jamie, can you hear us? You're muted.
All right, how about now?
Yep, go ahead. You have 3 minutes.
Okay, wonderful, thank you. The vision statement of the Salt Lake City School District Board of Education is excellence and equity, every student, every classroom, every day. This vision statement should be the foundation of every discussion you hold and every vote you make as a member of the Salt Lake City School Board of Education. This vision statement does not state excellence and equity for 9 out of 10 of your constituents, nor does it state excellence and equity for those who agree with your personal opinion. It clearly states excellence and equity for every student. What I have witnessed over the last 5 months is failure to adhere to this vision statement, failure to listen to voices of reason, and failure to provide excellent education to every student in the Salt Lake City School District. 100% virtual learning is not effective for every student. You are leaving students behind. Families and students have been asking for opportunities and choice for excellent in-person learning for the last 5 months. You have set many of the students in the Salt Lake City School District up for failure this year by not allowing for choice of in-person learning. Student education and student well-being should be the #1 priority as a Salt Lake City School District Board of Education publicly elected official. You have successfully burned every bridge that has ever been built in this school district. This is not about the West High community, the East High community, the Highland High community, nor is it about race. You have divided our communities with the lack of integrity toward your own vision statement. You have brought division, animosity, anger, and hatred to this district, all because you have not allowed for choice. We need unity. We need a sense of building bridges, not burning them, and widening the divide of our district. What I have seen coming directly from board members is treating each other, including the board president, with disrespect. This only widens the divide of this district. You should be treating everyone with respect, especially as school board members. What I have seen this year does not include excellence for every student. I urge each of you as publicly elected officials to ensure all students' voices are heard, not just 9 out of 10 of your constituents, and you provide choice of excellent in-person learning to every student who would prefer the opportunity of in-person learning. Your discussions and votes for the remaining tenure of your terms will speak volumes to your own integrity. You have the obligation to uphold the integrity of the vision of the Salt Lake City School District and ensure the remaining portion of this school year brings excellence and to every student, excellent education, as the vision statement suggests. Thank you.
Thank you. Okay, the next speaker is Colin Krebs. Colin, can you hear us?
Yes, I can. Thank you.
Okay, you have 3 minutes. Go ahead, Colin.
Awesome. I'd like to speak to the opposite of that sentiment. My name is Colin Krebs. I'm an alma mater of Indian Hills, Hillside, and Highland High. It's good to see you, Principal Schulte, again. I'm a concerned citizen today. I'm asking you to delay the start of in-person school. I would ask that you delay it based on vaccinations of all teachers, and so some of the students can get vaccinated first. Realistically, I may be thinking until April of 2021 after spring break. I am a community program manager at Salt Lake City Corporation's Youth City program. So we're running school day response and after school programming from 8 a.m. every day to 5 p.m. This is distance-based learning with 10 people in a room at max. I have a background as a certified teacher as well. I know that Zoom learning is subpar, right? Learning should be small group work, it should be kinesthetic, it should be musical, it should be interactive. You know, we're not getting that right now, but there's still learning happening. That's good, right? I have second graders that come in at 8 a.m. in the morning, they drink Kool-Aid jammer like it's coffee, right? And they get to work, right? They're doing grown-up stuff. They're logging in with an email, checking calendar for mixed assignments. They're doing their Zern, their Lexia, their SD Math, their Wonders. Basically, they're doing a cubicle job from 8 a.m. to 2 p.m., right? So it's pretty incredible. It was rough to start, but it's working now, right? They are productive members of the 21st century workforce at this point, right? The analogs to this in the past would be in 1918 when students had to do remote learning for Spanish flu, right? They would do reading at home. In 1937, in the polio epidemic, they would do remote learning on radios, right? And then kids would go to work because there was no such thing as child labor laws back in the day. So I think it's fine. I think it's good. I think the remote learning is not the best, right? Everyone would agree it's not, but it's working and it's fine, right? Last month's vote on the delay of elementary came down to Kristen Sweat's argument that enrollment is down this year and student grades are bad. And both of those are fine, right? If even there are 0 kids enrolled in Salt Lake City School District at the end of this year, and every student gets an F and everything, that's fine because those are not irreparable harms, right? You can come back from those, right? Things you cannot come back from, even one student dying from COVID, even one employee of Salt Lake City School District catching COVID, right? And not even just dying, right? We're learning about how COVID lungs are worse than smoker lungs right now, right? They're long-term disabilities, and you'll get this COVID brain fog, right? Long-term neurological damage. So I would say take the L this year. Do not care about enrollment numbers or grades. Keep everybody safe. I'm not asking you to not open schools ever. I'm just saying delay it a little bit longer, right? As Mohammed said last time, we're almost at the finish line.
Thank you, Colin. That's
thank
3
you.
minutes.
Thanks, Colin. Okay, the next speaker is Eric Thompson. Eric, can you hear us? Eric, can you hear us?
He's muted.
You're muted, Eric. Can you unmute, Eric? There, you're unmuted now.
Okay, that was harder than it should have been.
You have 3 minutes. Go ahead.
Thank you for letting me address the board. Thank you to all the teachers, administrators, and staff who work hard to support my family. My home and work life have been much harder during this pandemic. I know your lives are also. I want you to know that I respect the challenges and illnesses created by the coronavirus. Many people in my work have had the COVID-19. Our business is considered essential, and it has been a challenge to keep our business open when people are sick. Further, I wish ill health on no one, not teachers, nor students, nor anyone related to them. It has changed my life today. I have a new mask for each day of the week. A student entering a Salt Lake City school should be able to receive a high quality education. They should be prepared to learn in any field they choose after high school, including college, professional schools, and trades. Every high quality career today requires more education and training than in previous generations. I do not believe that Salt Lake City can provide those learning opportunities with online learning. I listened to Dr. Dunn and Dr. Hirsch speak at a recent Ensign SCC meeting. They both said it was okay to have in-person instruction, even with crowded hospitals and positivity rates above 20%. They said schools were not a major source of virus spreading. Their children are attending in-person schools. The Salt Lake School District children are failing at a much higher rate than in previous years because of online instruction. At East High School, the number of Fs have increased by 40%. The district-wide number has increased 59%. The school board needs to reverse this trend. The Salt Lake School District students are already behind their peers attending in surrounding school districts. No matter how hard our teachers work to teach online, only a limited number of people can learn effectively remotely. Students want to attend in person. They will rise to the occasion and comply with the health and safety prescriptions. The sports teams are allowed to play in person, not virtually. I have relatives who are attending in-person school in surrounding school districts. They are willing to be very disciplined to be in school rather than online. And students should be learning 5 days a week. Asynchronous learning days are non-learning days for my student. Thank you very much.
Thank you, Eric. The next speaker, and excuse me if I pronounce this wrong, is Tycee Summerhays. Tycee, can you hear us?
Yes, I can. Can you hear me?
I can.
Excellent.
Okay, you have 3 minutes. Go ahead. And can you tell us how to pronounce your first name, please?
Yes. Hi, my name is Tycee Summerhays, and I'm a senior at West High School. I'm speaking today because I know that a return to in-person schooling, even in a limited capacity, will at the very least prolong this pandemic, and I'm very concerned that the district is risking people's lives due to political pressure. Even if teachers are fully vaccinated before an in-person option goes into effect, there are still significant risks associated with returning in person. For one, while vaccinated teachers would be much less likely to contract the virus, the vaccines aren't a total guarantee. Even the best vaccines have a failure rate. Second, even if teachers were completely immune, the student population wouldn't be. Students may be less vulnerable to the symptoms, but minors have been proven to be capable of being carriers and have been hurt and even killed by the coronavirus. Enabling students to return in person would make it much easier for the virus to spread during what is the height of the pandemic that we have experienced thus far. West High, the school that I attend, would be a ticking time bomb for infections. The school is already overcrowded before the pandemic, and chances are basic public health measures like social distancing would be impossible in and between some classes. This all but guarantees easy transmission for the virus. I originally wrote this before the UK variant of COVID-19 was found in Utah. This strain is 50% more infectious than the original, and there is currently one confirmed case in our state. The CDC expects this new strain to be the predominant strain by March, and with its increased virality, going back in person will spread the virus to our communities. Chances are, even if schools start again in person, they are going to be forcibly closed because outbreaks will quickly occur. If the best possible outcome is a cycle of being in and out of person, We should do what's best for our communities and our safety, which is staying online. I know that people are suffering mentally and academically due to lockdown procedures. Personally, I'm also sick and tired of staying at home and have had to force myself to work much harder than normal to maintain my grades. I'm also still completing my college application, so I know how important a student's grades can be. However, the threat of a year of B's, C's, D's, and F's should pale in comparison to the threat posed by prolonging this pandemic. Sure, a student may fail to get into their dream college as a result of this pandemic, but that should in no way be seen as a reason to put people's lives at risk. It should also be noted that all students are currently suffering through this pandemic, which means Salt Lake City School District students aren't at that large of a disadvantage. Many schools that offer in-person options have had to shut down because of the way in which pandemics are spreading at those schools. If the biggest problem really is declining grades, then alternatives like increased awareness and access to tutoring services should be pursued. As upsetting as it is, chances are schools won't be able to return to normal until at the beginning of next school year in the fall. The ability to return in person in the autumn will be much more concrete if we maintain prevention methods like limiting secondary schooling to solely digital means. We mustn't understate the severity of this situation. Utah hospitals are at capacity. All of Utah's counties are considered to have a very high rate of transmission, and the death toll has exceeded 400,000 nationwide. It's difficult to make an unpopular decision, but it's a decision you need to make. I'd like to add that almost 1,200 concerned students, teachers, and parents have signed a petition proving that it's a mainstream opinion that you can support. Other people's lives are being put at risk, and I urge you to delay an in-person option until it is safe. Thank you.
Thank you, Tessa. The next speaker is Kelly Lear. And President Ford, this is the last speaker in the waiting room. Can you hear us, Kelly? You're muted.
Okay, how's that?
That's good. Okay, you have 3 minutes. Go ahead.
Thank you. I just had a few thoughts that I wanted to share today. I don't have a prepared written statement like I would have liked to. I was dealing with the online schooling for my children and also spent a lot of time listening to the court hearing today regarding the lawsuit that represented a group of parents that were advocating for in-person learning, and brought up a couple questions that I'm hoping that the board will address with you today, Superintendent Madden, and wanted to just bring a couple things to your attention that I hope will be discussed. First, just to the newest members of the board, at the last board meeting, I heard them speak very eloquently about diversity and wanting to encourage seeking for diversity as they search for a new superintendent and really reaching out to our diverse student population. And I sent those new board members an email that linked an article from a Yale economist that talked about the importance of being on, not just online, but in person, and that the school closures are deepening the education inequality in the United States. And I hope they'll take a chance to read that if they haven't already. A few things that I'm hoping to hear today in the meeting or that you'll address is, one, the vaccine rollout, how that's going to look. The pretty broad statement that you're tying reopening to vaccines. I'm hoping to hear more about that. I know it was a late hour. It seems like some of our big decisions are pushed to the later end of the meetings and we don't get maybe everything fully vetted. One thing, Superintendent, you noted in the court meeting today that 850 teachers were vaccinated already, an additional 300 this Thursday you're anticipating, which would give you about a third of the teachers and employees vaccinated. I'm wondering what, besides the age category, you're going to rely on as you roll those out. I know, for example, in our elementary school, 2/3 of the students are returning, therefore 2/3 of the teachers are returning. For the third of the teachers that are remaining only online, is it necessary that they receive the vaccine before secondary schools or other children have an option to return? I'm curious how that vaccination program is going to go, and hopefully we'll hear more about that. Another thing I'm hearing often in meetings is about small groups and how small groups are happening. I know specifically only for my elementary, they are not, and also for my junior high, there are none. The teachers are unwilling is what I've heard in SCC meetings. In fact, I was in one junior high SCC meeting where a social worker or one of the student counselors was talking about some students that were really struggling, and she was having a hard time getting them to attend an Zoom meeting. And when it was suggested that might be a good opportunity to utilize the small groups, she said that there wasn't space to socially distance 12 to 15 students in order to do that. So I think that maybe the small groups is not happening as robustly as you think they are. And I hope the board will ask for more information from the superintendent and district about what schools are offering that, how many are happening, how many students are being reached, because I think that that's something that until in-person for secondary is approved, that needs to be addressed. I know, Superintendent, according to your comments today in court, that you'll be announcing a plan for return for secondary at twice a week. I hope to see that increase. But
Kelly, that's 3 minutes. Thank you so much for speaking to the board.
Okay, that's all the speakers we have, President.
Thank you. And thank you to community members for reaching out and sharing your thoughts and opinions with the board. It matters to us. We would like to now move to the report section of our agenda, beginning with mental health supports. Superintendent.
Okay, today we have here Mindy Holmdahl. Mindy's the Director of Student Services and Counseling, and along with her is Emily Sutherland, who's the Director of Social and Emotional Learning, and Stacy Lindsay, who's the School Counseling Specialist. And I will turn it over to them. And Mindy, I assume you need to be co-host to share?
I need to. I'm the one, hopefully I can get
okay.
the power. I'm going to be advancing the PowerPoint. So if you can, perfect. Awesome. Thank you.
Okay. You're all set.
Oh, can you see it?
No, not yet.
Oh, okay.
No, he was saying I'm all set to share. So I'm getting ready to pull that up. Okay, let me get the slideshow going. Oh, not sure why it started at the end. Okay, now we're ready to roll.
Great. Thank you, Dr. Buendia. We really appreciate this opportunity to report on the work of school counselors and district social workers and the EES department is doing to support the mental health and well-being of students. My name is Mindy Holmdahl. I'm the Director of Student Services and Counseling. We have Director of Social Emotional Learning, Emily Sutherland, who's here to present today, as well as Stacy Lindsay, our School Counseling Specialist, and of course, Dr. Buendia. We'll go to the next slide. To address our mental health needs of students, we have more than 80 school personnel supporting them through counselors and social workers. We had a few years ago, we started a district social worker team. We have 6.5 FTE that are supporting that. As far as our school counselors, the board had supported a full-time counselor in every elementary school. And then of course we have wonderful school counseling teams in our secondary schools as well. Our Tier 1 SEL support and curricula and resources that all of our schools are utilizing. Emily Sutherland will talk more specifically about those. We'll also talk about our partnership that we have with Odyssey House that has been providing mental health services since the beginning of the summer over telehealth. And we'll discuss our professional learning opportunities that we've been providing to help support our counselors and social workers and teachers and administrators and parents and students with accessing mental health services. I'm going to go ahead and turn it right over to Stacy Lindsay, our school counselor specialist, to talk about the work that all of our school counselors are doing.
Thanks, Mindy. And thank you for the opportunity to be here. I'm excited to talk about counselors. Just to run through some of the things that we're doing, counselors have been, during this whole pandemic, delivering social and emotional learning lessons, either by Zooming into teachers' classrooms and delivering them live in person, and then recording that and making it available for students to view later. Or some counselors have created their own Canvas course that students complete by teacher assignment, or sometimes on their as an additional assignment. And second step is the curriculum that the board has supported for K through 8. And we've been using that for a long time, and that's what we're still using this year in all our tier 1 instruction. Inner Explorer is something a little bit newer. It's a mindfulness curriculum, and currently 19 of our schools are accessing the Inner Explorer curriculum, which is a 5 to 10 minute mindfulness daily exercise. Counselors don't necessarily deliver this, but they have been facilitating it in the schools for classroom delivery, and using it also in small groups. Counselors do short-term counseling. We've moved to a telehealth format. We revamped our parent permission form to include considerations for telehealth, and counselors have been able to meet with individuals and small groups. I don't know what group the particular parent was talking about at the middle school, but we do have some groups that are meeting in person and some that are meeting through Teams or Zoom. And also, as counselors meet with parents and students, they're also able to refer them out for community resources, link them to district resources. Counselors are doing a lot of home visits or porch visits, as we're calling them, where they visit with families on their porches and make sure that they have access to the resources that they need. Counselors are also involved in yearly training of students for bullying, harassment, suicide prevention, and also training staff at the schools in those areas. Another thing that counselors help with is a safe UT response. And I'm just going to go to the next slide, Sandra. So this is our district data for the past 3 years. And what it's showing you is the number of chats and tips received by Safe UT for our district. So a chat could be a student chatting with a Safe UT clinician. And if there's a tip that they would like the school to respond to, they send it on the next morning. And then counselors and sometimes administrators respond to those tips, which are often related to suicidal ideation or bullying behavior, and there's other things too, but those are the top 2 in our district. And this is just kind of a breakdown by school. And as you can see, most of our chats and tips come through the high school level. And that is why we made a decision, Mindy will talk about this later, but we made a decision to place our Odyssey House partner clinicians at the high schools, because high school counselors are highly involved in scheduling and college and career readiness meetings, and really can use the extra clinical support. Another thing that counselors are doing this year, we have a grant with USBE called the Super User Grant, and we have 2 schools involved in this. And basically what this grant is designed to do is to create 2 ideal schools where they have a student advisory board. They have evidence-based curriculum that's focused on mental health for students that they're delivering, and also an evidence-based curriculum that's focused on teacher and staff wellness, and also outreach to the community so that they can help them become more aware of mental health, parent meetings, and collaboration with community resources. We have 2 schools involved in that right now, Glendale and Rose Park. And there's just some links there you can click on later as you go through and just have a look at what they're doing. So many schools have their own parent meetings and their own parent mental health seminars, but these are initiatives that we have pushed out to the whole district, made available to the whole district. I don't know if anyone had a chance to listen to Dr. Christy Kane last month, who presented to parents on helping their students maintain mental and emotional health. But we've also had a number of other parent meetings and seminars that to help parents support their students. You're muted, Mindy.
Thank you.
And now for social workers. Back to Mindy.
All right, thank you. We were fortunate to begin a district social work team a few years ago. Representative Elison promoted House Bill 373, which provided a lot of funding and support with a focus on mental health and well-being for students. With those funds, we were able to begin a team of 6 district social workers. It took a year or two to build over time. And then last year, we also added a half-time social worker specifically for the hub schools. The social workers are placed in the middle school programs and they serve the feeder patterns. But as we've added more social workers, we've been able to dedicate one specifically to the high school, and then through some other grants that we'll talk about, use our community partners to have LCSWs supporting all 3 of our traditional high schools. Working with our counselors, you can see on this slide, these are the number. We built a database to try to keep track of what kind of services our social workers were providing, just kind of for self-reflection and being able to understand, how many kids we're serving with the team that we have. This slide talks about the 928 different types of meetings that our social workers have had, whether it's families or groups or home visits. You can see that telehealth, once we went into our COVID closures, you can really see the uptick in the number of social work services that have been provided just by our district social workers. We think that, the ease of being able to meet remotely has been really beneficial to students and families. And our next slide talks again about these individual services, and it's more of a breakdown by schools. Essentially, working with our counselors and school admin teams, our social workers address the Tier 3 needs of students. So students experiencing significant loss, like a loss of a family member or a major life change, maybe, going through a divorce or some other type of major life change. Lots of our students have experienced traumatic events. We've had so many things that have been going on in our world that have really impacted our students. The social workers work with the school admin and counselor teams. Parents can refer themselves, or the teachers can report to a student services committee that they have a concern about a student, and that the school level teams will also then refer out to the social workers. Our next slide is, again, just that breakdown of those telehealth numbers and the kids who are and teams who are accessing those mental health services over Zoom meetings. And again, students and parents can request support directly. And I think our next slide might talk about Odyssey House. No, we'll transition to SEL links, and we'll get to our Odyssey House partnership in a few minutes. And right now I'm going to turn it over to Emily Sutherland to talk about the SEL links and resources that she leads through social emotional learning.
Yes, thank you. So I think that we've been trying to strike a balance this year between adjusting to needs and being flexible, but also offering comprehensive resources. And I think, people in all disciplines are sort of understand this approach. Like, we're trying to adjust to what people need, but also make sure that we're offering comprehensive services. So it's the same with social emotional learning. And I've worked really hard to compile resources in a simple format so that they're easy for people to find. And one of the ways we've done that is through the banner on the district homepage. It's one of the first pictures that pops up with the kids who happen to be at Wasatch Elementary, kind of standing in that star formation. And it says social and emotional supports for students, parents, and employees. And this was really a request to compile information in a way that was easy to find so that people didn't have to weed through lots of different websites to see some of the things that we offer. So on that banner on our homepage, you can click on students, parents, or employees and see some of the things that we're offering in terms of social and emotional supports, including like the parent meetings that Stacy and Mindy just mentioned. On those pages, we also have a link that says district response to COVID-19 resources. Each one of those buttons has that link, and that is a much more comprehensive list of resources that we actually created way back in April or March, and we've been updating consistently, and that one is much more comprehensive. So again, just trying to strike the balance between having comprehensive resources but making it simple and easy for people to find, because we're aware that people are stressed and sometimes don't have a lot of sort of energy to go searching through our website to find what we offer. Another document I created is called 5 SEL Tips for Return to In-Person Learning. And this is a document that I presented to elementary principals at a meeting last week. And again, it was my attempt to create very simple tips that principals can consider as they bring kids back to in-person learning over the next couple of weeks. I just want to make things simple enough that I realize a lot of our educators and building leaders are overwhelmed, and I want to keep things as simple as possible so that they can find things and utilize them as best they can. Next slide. And then just an update on the SEL curricula that we have here in the district right now. Stacy mentioned InterExplore, which is a mindfulness program. We did purchase 12 full licenses way back in August, September for schools. And every other school in the district has the opportunity to experience something called the initial experience through InterExplore, and that is for free. So they have offered that experience to us, and any school that's interested in just sort of playing with the program and seeing if they like it, all they have to do is contact me and I can get them set up in 1 or 2 days with InterExplore. Second step is our SEL curriculum for elementary and middle schools. And we're using that weekly with students in our elementary schools and middle schools. And then we're going through a process right now to select a secondary SEL curriculum. We have a committee and we've already narrowed vendors down to a group of finalists, and we're at the point where we're soliciting teacher and student voice on those vendors. We want to make sure that we know how engaging it is to students, how teachers feel about the prep, and that sort of thing. And we're hoping to have that ready to go in the fall. So we will have not only mindfulness programs for any schools that are interested, but also specific SEL district approved curriculums for elementary, middle, and high schools.
Great, thanks, Emily. Our next slide is about Odyssey House. Our district has partnered with Odyssey House for more than 20 years. We've had a program and a partnership through Horizonte, and then recently through a Department of Human Services grant that we received in partnership with the State Board of Education. We have been able to leverage resources to, again, address those slides that we saw with the numbers of high school students who are expressing need through that Safe UT chat. Our Odyssey House, those Department of Human Services dollars have been used to hire 2 licensed clinical social workers That is a link to that has been on the district main page since this summer. And parents can refer themselves, students can refer themselves. They click a button and Odyssey House will get back to them the very next day. So when we returned, because when we started this grant, we weren't, we weren't in remote learning. And so once we return to in-person learning, we'll determine the best way to serve students across the district and also have that focus at East, West, and Highland. Our next slide talks about the specific data of students who have been referred from Odyssey House. This one is broken out with just specifically the elementary school students who have utilized that resource. So over 60 elementary families have utilized that and made connections with Odyssey and are receiving services. And then our next slide is the middle school students referred. We have participants from all of our middle schools, and we are at about 12 students here. And then our high schools are, we included SPA as well on this. They have served 61 students have been referred. So along with trying to develop these individual one-on-one services, we've also been focused on what can we do to support teachers in the classroom, along with the types of things like Second Step and Explorer. But in addition to that, how can we build skills with counselors and social workers and school teams? One of the things that we have is a Cognito Resilient Together, Coping with Loss at School. That training, if we could bump to the next slide real quick on that, Sandra. We've had, almost 300 teachers, counselors, administrators, paraprofessionals who completed this in August. And it's a great interactive way for people to get I'm sorry, I'm losing the word for it. It's like avatars. It's a role play. You essentially go through a role play of students who are struggling, of maybe coworkers who are struggling, people dealing with stress, and it walks people through a way to identify a student or a coworker who may be in stress and how to support them through the resources that we have. So that was an exciting, and we received really positive feedback on that. So we could go back to the previous slide, thank you. Another thing that the social workers and school counselors have done a lot with is the question, persuade, refer. Suicide prevention. Also, one of our school counselors did this for all of the transportation department last year, recognizing that school bus drivers see kids before the day begins and at the end of the day. They're really these strong touch points for students and can really recognize when students might need some supportive services. So we did some training with them last year. Also, another thing that's up and coming is Terrace Matrix, which is again supported by that Department of Human Services grant. And this will be something that parents can opt into, and with parent permission, their children can have a mental health assessment. We'll start with the high schools. This is something we've been developing. Additionally, we've had Keegan structures. I'm wondering if Dr. Buendia would want to talk about, just the way that engaging classroom structures have been supporting our students.
I can certainly speak to it, and I'm going to ask Dr. Hall to chime in if I miss anything, because it was truly a collaborative endeavor between three key departments: educational equity and student support, teaching and learning, and school leadership and performance. And so as our second social emotional signature practice was introduced this year and focused on engaging strategies, what we facilitated was the opportunity to provide Kagan cooperative learning structures and strategies to every school in our district. They had an opportunity to send a team, and we primarily asked them to adapt to how to implement these strategies for engaging practices and engaging students with equal participation among all students, to adapt it to the online setting. And so they were able to do that. Teams were then responsible for taking it back to their schools, introducing it to the rest of their faculty. Of course, it aligned beautifully with not just our SEL priority, the board priority, but also the literacy, because the more you have students engaged, the more they're going to be developing literacy, all levels of literacy.
Yes, and these structures really provide that opportunity for students to connect in class. It engages them in the content and also engages them with each other and having that opportunity to connect from their homes. Additionally, we have welcoming schools. We know in Utah, suicide is really high among students who identify as LGBTQ IA or plus. These welcoming schools curriculum, we just did a training for all of the counselors across the district. It was a fantastic training. It was specifically focused on supporting students who may identify as transgender. And additionally, we have schools who are going through the full curriculum with welcoming schools. I'm going to have Stacy, if you wouldn't mind talking a little bit about the dialectal behavior therapy that training that we did for all school counselors and social workers.
Sure. So dialectical behavior therapy, or DBT, you may have heard about it, is an evidence-based clinical response to self-injury or suicidal behavior. But DBT steps A, or dialectical behavior therapy in school settings, is a non-clinical application of those skills. And we wanted our counselors and social workers to be trained on not just responding to students who may present with suicidal ideation or other behaviors, but also to teach them skills that can prevent them from getting to that point. And the 4 DBT skills are mindfulness, distress tolerance, interpersonal communication, and interpersonal effectiveness, and emotion regulation. And so it's a series of exercises and ways of being that teach those skills.
Yeah, it's excellent skill building. Additionally, again, with, as I continue excellence and equity every student every day, it's important to make sure all of our school counselors are aware of understanding institutional racism and education. And we've been working with Dr. Gutierrez since last year in an ongoing series of trainings for all of our school social workers and counselors. And we'll discuss that. Great.
Okay, so we cannot miss an opportunity to thank the school board for your ongoing support and dedication to the work in centering students and promoting educational equity every day for every student in every classroom. And we just wanted to highlight some of the ways in which you have funded many initiatives and many services that really enrich the lives of our students, as well as providing opportunities for students and families to enrich our lives. So this is a list. Full-time counselor in every elementary school. SEL, we hired an SEL director and dedicated that work in within a department, even though, and we do collaborate with others. So it's not Emily all by her lonesome self. Of course, we had the SEL framework implementation. This is year 2 of implementing that framework. Second step curriculum, we're selecting the secondary curriculum, Inner Explorer, Mindful Schools training. We've had many teachers, administrators, counselors, social workers, anybody who's interested participate in that. And then the mindful based stress reduction training has been offered as well. So with that, we just want to, again, thank you so much for your ongoing support. And with that said, this is an opportunity for you to ask questions.
Thank you, Dr. Buendia. I'm really grateful for your time tonight. What I'd like to do is open this time up to the board to ask questions, and we'll remember our training that says we'll let everybody have an opportunity to speak once before somebody speaks another time. So board members, this is your opportunity to ask questions. Hoel Lee?
First of all, I want to say to the people that presented and all the people that you kind of represent of doing the work, right? Like, thank you. Like, you know, it's amazing the work y'all doing, and you know, for the board, I think it's good to know that even that last slide was all the inputs and outputs, right? And now we're kind of seeing the outcomes of what students are being resilient, you know, in terms of just connecting it to our trainings from last weekend. So I have like 2 main things. One thing is the secondary level SEL curriculum you're going through or looking at. I would love to be engaged in that. You know, I have background in this a little bit of, and just, you know, I would love to see what curriculums you're looking at. Like last weekend during the retreat, I shared to the board some you know, stuff that was published about radical healing framework. I'm not sure if you're familiar with that, but you know, the way SEL intersects with you know, critical race theory, and also just other important elements of civic engagement, and just how they're all really connected. And so I'll share that with you all, so that you can see that. But I would love to see just also what other curriculum you're looking at in the high school level. So that's one thing. And then so the other thing is, I'm super excited to see that there's a lot of professional development, right, happening to the teachers. And that's how we kind of, you know, it's not the responsibility just for the counselors. I think that for a long time people thought it was just that, but it's also the as you mentioned, the bus drivers, right? Every person being informed as adults, and also as students being informed about how they have a responsibility, and through empathy, a desire to help one another when they see anything, especially when it comes to suicide prevention. Especially with Mindy and I, when we're at Horizonte, there's a lot of work that we did, and it's good to see all those Horizonte students taking advantage of these services. So beautiful. Thank you so much for all the work you do, and like I said, I'll be connecting with you all on different levels in that.
Christy, go ahead.
So first, I just want to say thank you to Sandra and Mindy and Stacy. What a great report that you've given us tonight, and lots of really good information. I know we've talked about social workers, and we continue to work our way into adding more social workers. I don't know, Mindy, or Sandra, at this point, I think that we need to move into our secondary, but can you talk a little bit about what you think the needs are at the secondary level, and how many social workers you think that we would need to at least start with and then phase in? I don't know if that's something you've all been talking about, and if not, then just say that, you know, that we can certainly start that conversation, you know, with you at some point.
Yeah, we've had, as you can imagine, and we've had a lot of conversations about what our current and future needs are. So I'm definitely going to allow Mindy to address that if you feel comfortable, Mindy.
Yeah, absolutely. I really think with your question being specifically about secondary, a social worker in every high school and middle school to work with the school counseling team would be ideal. Someone that, the wonderful thing as well about Odyssey House is that they were present over the summer. So we talked a lot about what, once we hit those summer months, how can we extend contracts to either be all year, or can we, utilize our community partnerships so that students can continue to have that access when they're not necessarily in school. But I mean, the ideal, of course, would be a social worker in every school. But to start, just looking at our data and knowing the high needs at the secondary level, one in each of the schools would definitely be amazing.
I appreciate that. I think that we all know our school counselors aren't clinical social workers, and I know that they're carrying some of that load. And so for us to start looking at, even at a school with, it's like Highland, it has 1,800 kids in it, eventually you'd probably want 3 or 4 social workers in there, looking at their caseloads, you would want to make sure that we weren't overextending one person. So that's really good food for thought for our board. And Sandra, maybe this question, I'm wondering, how is it easy for our families who are not native English speakers to access all of these services the same way our English speaking families do?
Not with the ease that English dominant families access the information. And that's something we've, anytime we have an opportunity to provide interpreting services or translation services, we do that. However, I'm going to suspect that some of our families who have experienced challenges accessing the daily curriculum and instruction are probably struggling to access some of these resources for the same reasons. Trying to find time during the day, if they're working more than one job, if they're trying to balance the demands of having children to support at home and a job, and all of the other demands that competing demands that make it challenging for many of our families. And so that's something that we can definitely, I would suspect that there's room to improve.
Well, I think that I appreciate your honesty, Sandra. I think that certainly is an area where, all of your brilliant minds can come together and come up with some ideas and things that we can work on and make that proposal towards that CARES money, that's going to be made available through the state. What a great opportunity for us to be able, to do that, but also for the future, not just when we're in remote right now, but, for longstanding and to be able to phase things in as we need to. So thank you for your honesty. Thanks so much, you guys. I appreciate your time and the report that you gave us tonight.
Catherine?
Thank you. I also want to thank you for putting together this report. We didn't give you much time and it's very helpful. I would like to know what kinds of things you would like to do if you were given funding, reasonable funding to be able to do it. And, that the school board could give in this year or next year.
Can I go on that?
Yes.
Okay.
Yep.
Absolutely, like we discussed, having the FTE to have social workers working with our counseling and admin teams in every school. Again, kind of covering those summer months, having ideas and resources so that there's not a break in services for students. And again, with the FTE, just being able to offer more groups, more individual meetings, more ways for parents to connect. Our social workers started a parent group. It was just kind of getting going. Having
like those alternate hours, like the time that we ran that program was probably not ideal for working parents, but some were able to participate, but it's those evening hours when we could probably get more participation. And again, like was brought up in terms of services for interpretation. 2 of our social workers do speak Spanish, but as you know, we have over 80 languages represented. They do use our translation services, but the ability to have more multilingual social workers would definitely also be ideal. I don't know if Stacy has other wish lists she would want to add.
Of course. Just speaking to the high school counselor issue, I feel like, yes, definitely a full-time social worker in every high school would be optimal, but also school counselors can take care of a lot of those tier 2 needs. Not every student needs, clinical intervention. Some of them just need more touch points or a small group, and school counselors are perfectly capable and trained to do those things. And unfortunately, so much of the time of the school counselor is spent doing the scheduling and those career and college readiness meetings, which are super important. And that is, I wouldn't want to trade the college and career readiness meetings. And that's one touch point we have with students too, to check on their mental health and wellness. But increasing counseling staff at high schools, along with the school social worker, could free up more time for them to take care of tier 2 before it gets to the level of tier 3.
Thank you, Stacy.
I'll just chime in really quick from a social emotional learning standpoint. Whatever Mindy and Stacy just said, I agree with 100%. From my angle, I think it's just great, the social emotional learning funding that we have, and that continued funding would be amazing, because the various curricula are expensive. They have varying prices to implement in all of our high schools. The mindfulness programs, same. And then any kind of like measurement or surveys that we're looking at in the future are also can also come with a various prices and that sort of thing. So just all the social emotional learning funding and the way we're learning it, we're using it for instruction and measurement is great.
And I'd also, thank you, Emily. I'd also like to throw in staff. Today, before this meeting, we had a mindfulness-based stress reduction class for people across the district. We had, more than 20 people participating, and the teachers and, school staff that are participating, acknowledging their mental health and wellness. I know we have our program through Blomquist and Hale, but also just these opportunities to get together, learn some relaxation skills, learn ways to cope with the tremendous amount of stress that so many of our teachers have been under. When teachers have that opportunity to practice for self, every class, and we've done several classes now over the last 2 years, every time they're connecting with how it helps them in the classroom and how it helps them not react to students, be more curious with students, take a deep breath, understand when their heart is getting, like it might start racing, or when they're reacting to a situation, and helping them be in a place of calm as well. So I think those ongoing opportunities for school staff is also super important.
And I guess I'll close it out by throwing something else out there that's, I hadn't considered this prior to our conversation with Granite School District today, and their nursing approach to addressing COVID exposure and reporting and contact tracing and all that. I had never considered until today, hearing from Judy Jaworski, who's our lead nurse in our district, and all of our nurses are doing an incredible job, but also talking to the lead, one of the lead nurses in Granite School District, the amount of counseling that they do with families related to fears that they as guardians or their children may have in relation to, for right now, the most urgent matter is, COVID-19 exposure. But if we think about that, that's something to consider, because our nurses are taking that on in terms of being the individual to communicate, calm families' nerves, calm students' nerves. So they're meeting their emotional and mental health needs in relation to how frightening COVID is for many. But I would suspect also in addressing, for example, 504, or not 504, the health plan, the healthcare plans and those kinds of things. So if there's any change to spare, I would say it would be awesome if we can have additional nurses as well. We learned that we really need to increase that number.
Thank you all. Board members, we haven't heard from everybody. We don't all have to speak, but I want to give you everybody an opportunity to. Dottie, do I see your hand? Go ahead.
Yeah, that was my hand. Sorry. I would say, first off, thank you to all of you who have presented this really comprehensive PowerPoint. I'm grateful. And thanks for spending your time with us. I think there are a couple of things that I kind of want to say, which is that it's a little bit concerning to me that we are still looking towards students reaching out for help rather than the other way around. I think there's a lot of stigmatism around mental health and mental health help. And the only way to reverse that is to normalize it and make sure that our mental health resources are reaching out to students. I haven't been reached out to by a single person my entire, my entire tenure at Hawthorne Elementary, at West High School. Not once have I been in contact with someone whose only job was to help me and who reached out to me. And so I don't know, that's kind of concerning to me because we're still asking students to bear the burden of reaching out for help when someone else should be reaching out to them to see if they need help. To that extent, I would like for students to have a mandatory meeting with a licensed clinical therapist once every quarter. I know that might be a question of funding, but I think that it's worth it if it means that students will be healthier and happier, because I think above all, that's the most important thing that the district is here for. And so I think by asking for a mandatory meeting for all students to check in with a therapist, that normalizes that mental health stigmatism. I also wanted to double check for the Odyssey House. I know that there was a graph that showed all three high schools, West, East, and Highland. But then earlier on another slide, it said that the social workers will be available in East and at Highland High School, if I'm correct. I want to make sure that those resources are available for West High students because we're a high risk, high need school. And I want to make sure that we receive the same resources as other schools will. So that's kind of what I have to say. I really hope that we tackle this head on. Students deserve better mental health resources, and we deserve the privilege of having other people reach out to us because we're worth it. So thank you.
Thank you, Dottie. Mohammed?
Sandra, Mindy, Stacy, Emily, thank you so much for everything that you are doing, especially during these hard times. It's been quite a rough year, and it continues to be. COVID-19 unfortunately has impacted so many lives. And not only that, it also has taken so many lives, and I can only imagine the emotional effect that can have on students, and in return also their parents are affected by that. So I want to personally thank you for thinking about students, teachers, and staff in doing that. And at the same time, I want to second what Dottie just said. Thank you, because schools would not be existed if it was not for students and teachers. And our Salt Lake is a very diverse city, and we have a very diverse district. And we need, to put in as much effort as possible in finding, more multi-language social workers and counselors. The reason I say so is because, there is no better way to connect with someone who is emotionally affected than using their own language. It makes a big difference. Trust me, I'm talking from my experience. It makes a big difference. And, we would love to know what methods you guys are taking, what steps do you do to search for and reach out to the marginalized communities, kids with, different languages. And not only that, also I'm thinking about the, the refugee communities here. Here we have COVID. And here we have the post-traumatic stress disorder that these children and their families have gone through. And you can only imagine how much help they will need. But also bear in mind that there are cultural barriers in that, because where we've come from, going to a counselor is not a good thing. We looked at as like very weak. Trust me, it took me an arm and a leg to have my wife finally yell at me and say, okay, you've been in service, it's time for you to go to a counselor. And imagine, after all those years, and I've done it. And there is nothing wrong with that. And please, when you have kids with different language, Arabic, French, or Berber, or any spoken Arabic, Northern Africa and Middle East, and you need someone to be there and speak their language, do not hesitate to call me and have me be there. I'll be more than happy to be there. Thank you. I don't know what to say. It is a hard time, and I appreciate everything that each one of you here is doing, and know that we are here as well to support you in any way possible. Thank you.
Thank you. Okay, well, seeing no other comments at this time, I really want to appreciate Dr. Windia and your team for being here, for presenting this presentation to the board on short notice, and having it be so comprehensive. We have lots of future conversations about this in our future. Thank you.
Thank you all, and thank you for your feedback and recommendations. I appreciate it.
All right, we will now move on to the second item on our report agenda, elementary in-person option updates.
I'm going to hand that one over to Becky Pittum. Becky, I will make you a co-host. Okay, you're all set.
Thanks so much. If you can see that, if we're right at the beginning and you can see it. There we go. Give me a thumbs up. Are we good to go?
You got it.
Awesome. Okay. I'm excited to give you a brief update and a picture of our elementary kids getting ready to go back into the schools in mass on 1/25/21, which is next Monday. And we're very excited about that. So in order to do that, I just first wanted to say that I think it's important for us to understand a little bit about our elementary schools, and that you, particularly for those board members who are new, I wanted to give you a picture of those schools so that you could have a better understanding. We have 26 elementary schools and 2 kindergarten through 8th grade schools. All told, it's 10,717 elementary students. That's a big number. Lots of kids, wonderful children who we look after every day, the whole child, and care so deeply about. With that, we have 686 teachers, something interesting to think about. And if you look at the ethnicity of our students, want to give a shout out to Jeff Lutz and to Michelle Amiel from our assessment department. Jeff Lutz made these beautiful slides that really help us paint a picture of these students in a clear and cohesive way. Notice our students with disabilities and students, SES, those students who would qualify for free or reduced lunch. Look at that number, 5,874 of the 10,000. That's a big number. Shows just how many of our children need us, not just to sustain them through academics, but make sure they have breakfast and lunch every day. Knowing that we've had that little bit of information to help you better understand our schools, wanted to focus on the great things that have been happening this fall. And I love this slide. If you look up here in the corner, you've got robust remote learning going on, and with this student explaining her math problem. And then the other corner, we have a small group happening. Small groups have been happening in many of our schools all fall long. In fact, our special ed students have been coming in all of our schools. It's what we have been doing. In addition to that, teachers have been sending packets home, and kids have been going into the buildings to pick up learning materials. I know teachers have put together science kits and reading kits and math kits. And then not just academics that we've been focusing on, but I love these 2 pictures from Edison Elementary of their recent coat project, where they gathered 400 coats and made sure every student had a warm coat. And it's not just Edison. These kinds of things happen in every one of our buildings. So knowing that these great things have been happening in our buildings all fall long, we have been looking forward to the day when we would be back in person with all of our students throughout the day. And in doing that, we've been preparing in advance. And that preparation has been extensive. We've met weekly with administrators. As part of that, we've had people come in and present to them. We've taken groups of administrators out to elementary schools from different districts that are in session, so that we could know for a surety that when our students return, they are safe, and not just when they return now on Monday, but throughout the fall. We've been making sure that all of those procedures and protocols are in place. And these 3 slides these pictures are actually from our schools. You can see Whittier here. This one on the far right is from Parkview. Love that these communities, these teachers have been getting together, working with their administrators to plan and prepare in advance. Part of that planning and preparing in advance is making sure that we have information from the guardians of our students. So this says here, how many guardian surveys were returned? Oh, I'm so proud of this slide. If we were all together, the feeling, if I could give it to you, 92.48% of those surveys returned. That is phenomenal. If you go back and you think of the fact that we have 88 languages represented, that 92%, we made sure we heard from those families. It was critical to us. And kudos to our administrators and our teachers who went out and knocked on doors, who called and called, who got translation services, who made sure that the information we have from these guardians is representative of our district. Just so pleased with that. We have some schools that got 100% return. One of those being Parkview. I mean, it's just amazing. So proud of them. Now our survey results from guardians, roughly 64% chose that they would like to be back in school in person, have their students back in school in person. Now, mind you, this is the survey that we did the first or second week. I think it was the second week of December. So it's relatively current, as current as we could be for right now. And this was the response. In addition, I'm going to actually, I do want to talk about one more thing before I talk about this slide. We also surveyed our teachers and our classified staff at the same time. And you received that information last week from our superintendent, Mr. Madden. So it's important to note that we took into consideration all of that data, the teachers, the classified staff, what our guardians and parents were saying, and what our administrators have been saying. Mind you, some of that data is split. We have some administrators who feel that it isn't as safe as they wish it would be before we return. And then we have some administrators who cannot wait to get back in with everyone back in on Monday. But the point is that we went out and got the data, and every school has done that. Wanted to show you that once we collected that data, every single school had to make a plan about how they were going to re-enter. So this is not being done lightly, and it's not being done in a haphazard way. If you look, you obviously can't see these two slides, but I just wanted to show you it's extensive. Every administrator needed to fill out both of these forms. And the first one here on the left talks about the process they went through to come up with their plan, including to make sure that they had included their teachers and that they included SIC. Those who were going to do alternate reentry plans needed to include SCC in those plans. And no matter what, communication was key with parents, with SCC and SIC. And they're asked multiple times, have they done that? And then this one on the right goes through all of the safety protocols and procedures that they need to have in place. So when these students walk in the building, well, as they've been walking in the building this fall, we've been putting these procedures and protocols into place. But on Monday, when we come back, these are all in place and ready to go. Those schools who did want to have an alternative plan, chose to have an alternative plan, they had to answer 21 questions and assurances. It was a whole nother form, and then they presented to a committee. That committee included people from our school community group, from the foundation is what I mean by that, so that our after school people were represented. It included transportation and foods and nutrition. It included special ed, so that we had a really good idea if anyone did choose to have an alternative plan in their reentry, that they were covered in all of those areas. I think I skipped one slide, and I want to go back because it was critical. There we go. This is probably one of the most important slides, in that whether a school has an alternative plan or whether they have they're all going by the default of 6.5 hours and a regular schedule starting on Monday, every single plan has an in-person full day option. Every plan has this phased return. There's one plan where they all come back starting on Monday, everybody. But they all, at least, we start with our building doors being open for any student whose parent feels they need to be there full time. 6.5 hours of instruction. Wednesday as a digital day, where the first hour is synchronous learning with their teachers, so that everybody gets that check-in. We're going to talk about that and how important that is in a minute. Every single school has to show they've got access to breakfast and lunch. We already proved how important that was by our numbers, right? At least half of our students rely on that. Every student receiving instruction in arts and library and PE. Our after-school program being accommodated to make sure that if parents need their students to be in after school, they can be. That SICs have been part of this, and that principals are making sure SCCs are aware of what is going on, and that approval was given in special ed, transportation, and nutrition. These plans were not just thrown together in a haphazard way. Now, once these plans are put together and we've gathered this data, then our principals had to get right down to work and start deciding and helping teams, because they actually went to every team, kindergarten, first grade, second grade, third grade, fourth grade, fifth grade, sixth grade, and together worked the problem of how are we going to balance these classes so that those students who want to stay remote will be able to stay remote and have a robust program. And those who want to be 100% in person can be. And what we have is four basic things that you're going to hear about, that you will hear about as parents discuss where their children are going. Some have a 100% remote classroom. Some have 100% in person. They're going back just the way it was before. And then, well, not exactly the way, obviously it'll be different, but going back in a more traditional way. Some classrooms chose to be expanded. We have teachers who chose with their teams to handle both the kids that want to be in person and those who want to be remote. They've forged relationships with those students, and we know how critical that is. And parents have asked for that. So some teachers said, yes, that's what I want to do. Teams said, yes, that's what we want to do. Again, I want to point out here, there may be one or two here or there that say, well, that's not really what I wanted to do, but that's what my team wanted to do. This won't be perfect for everyone. I have to venture forward and say that, because nothing is perfect for everyone. But we've done the best we can to make it the best it can be. Then pod placements. In some situations where numbers did not work with remote and 100% classes, then principals got together and helped one another. For example, I know of some students from Dilworth Elementary who will be attending in remote a classroom at Highland Park. But that beautiful collaboration has been and is powerful. I know to some this has been concerning, but I would tell you I have gone through and been looking at the numbers today, and I think in the end we'll have less, I would say less than 40, probably more like 35 children in this situation out of 10,000. That's not many who will be attending a different school in a pod placement. And those parents have been contacted, and they will be loved and accepted by those teachers and still have a connection to their home school. Once our administrators got those classrooms arranged, and they're still in the process of it. In fact, today, as I was gathering I try to get up-to-date data. I had administrators saying, well, I have parents calling me every day saying I've changed my mind. And we are really trying to work with parents. So this is there's still a little bit of flux. But the next step is every single school has developed a guideline book for parents, a handbook. You can see here's the one for Uinta, and here's the one for Whittier. I love that they are tailor-made for each community. We could have just made one and had them pass it out, but it wouldn't have nearly the impact that these will have. These are tailor-made for each community, and the principals will be not just distributing them to parents, but they will be on every single school website as well. And when you get into these handbooks, the handbooks detail procedures like what's going to happen at lunch, the questions as a parent that you ask, that you're concerned with or that you worry about. All of those are contained in these handbooks. Now I want to get to the next point, which is we've been through all the nuts and bolts, right? We went through all those nuts and bolts. I want to get to another piece of meat that I'm so excited about with this. And that is that we know over the last year, all of us, adults and children, have been through unsettling experiences. I love that word, unsettling, because that's exactly what it's been, unsettling. And that those unsettling experiences can cause trauma, not just for children, but also for adults. And I want to go back and talk about how we have connected all along, all fall and moving forward. We're working so hard as a district to work together, to collaborate department by department. And in this case, we have worked with Ed Equity and Student Services to really focus on the emotional needs of our students. Of course, we're going back and we want rigorous academic instruction that's differentiated for our students. That's a given right now. But also, we know that our students need this focus on social and emotional well-being. It's the well-being. If we don't focus on this, they'll demand it, because as we know about, if you know about child development and about human development, these needs have to be taken care of before you move on. And so if you look at these 5 intervention principles, I'm going to just mention them. Promote a sense of safety, promote calm, promote connection, promote a sense of self-efficacy and collective efficacy. Oh, and I love this one, and I actually just have chills even reading it. Promote hope. This is our job, not just for students, but for adults. So how are we going to do that? We have together, working with Teaching and Learning and with Ed Equity and Student Services, we have put together this social and emotional focus that all elementary schools will be working on. There will be a group and individual check-in every day. Dottie, I loved it when you were saying we need to go to them. This is where we're going to them. So as you have those students around you and you're looking on the screen at the students who are remote, you are checking in with each one individually, not just a whole. You're checking in. You're seeing how they're responding to you. What are their needs? And then again, checking out at the end of the day. We have shared classroom lessons. Stacy and Emily have put together great lessons, and they'll be given to all teachers. Great activities, lessons and activities that build self-efficacy, that build resilience, that build empathy, kindness, right? And then in a minute, I'll show you 5 key SEL practices that Emily has put together for us, that all of our teachers will be working on in the elementary grades. And then my favorite, a literacy focus. We're doing a literacy project. And actually, this is going to be K through 12. We know the power of good literature. Think of the books that have influenced you in your life, that have touched you, that stick with you. And what we're going to be doing is using literature as a way to connect with the heart and soul of kids. And our Teaching and Learning Department, Tiffany and Katie Aramia, with our Student Services Department, with Ed Equity, they're putting together a list of books. They're actually purchasing these books and making sure that these books get into the hands of students. Books that reach to their hearts and souls, get to their well-being. We'll have practice, we'll have activities based on these books. We'll make sure that these books are multicultural. A perfect way for us to build this bridge and make sure that the well-being of our students is addressed. So with that, let's look at these 5 SEL tips. Love this. Emily made this. She's got to be a graphic designer in her spare time, right? The idea of that welcoming practice every day, making sure we're providing mental health support, and making sure our parents know how to access it. Making sure that lunchtime is an enjoyable time, even if they have to sit 6 feet apart, and we have all those practices in place, that there can be music going on or other things to try and help them feel some peace with their friends. We practice mindfulness activities, and then of course, focus on activities with strong engagement strategies to meet the needs of children. I've gone over a lot, and I've gone over it as quickly as I possibly could. We showed you a glimpse of what our elementary schools, what makes them, what they're made up of. We showed you a bit of this process that has been detailed, and at times it's been a struggle as we've had people, administrators and teachers and parents across the board with all different viewpoints, right? And we have to acknowledge those. We have to take all those and look at those, and not just look at them, but try and balance them. So it's been a big job, but then coming up with plans based on data that will allow us we're all excited on Monday to go back in to see these children and welcome them in mass, not just in small groups, even though we'll continue with small groups as well. And we'll continue with a robust remote program for those families that want it, right? It's been a journey. And before I give you a moment to ask me questions, I just want to highlight that it is a journey. And I want to say thank you to our teachers. There's no word, there has to be a better word than thank you. Maybe someone has it. For the hard work that they have put in. Not just the hard work, but the heart work, the heart and soul work. And the same thing for our administrators. Giving it their all, and I appreciate that so much. I appreciate our parents for the struggles they have gone through every day and continue to go through. Appreciate our departments in our district. Do you know every single department in this district has been involved in these plans? Every department. I'm thrilled with that collaboration, and it's been powerful to see it. I appreciate the people in our department who have helped, and to Brian and Chris, the network directors, and who have really worked hard with schools. To Larry for supporting us. And then our board for supporting us and walking this journey with us, and the journey's not done. So Larry, I know you told me to hurry, and I'm hurrying, but I'm going to just finish with one thing, because we talked about how powerful literature is. And so I'm going to read one piece from one of my favorites, Mr. Rogers. He's one of my favorites. And this is what he says. When I was very young, most of my childhood heroes wore capes, flew through the air, or picked up buildings with one arm. They were spectacular and got a lot of attention. But as I grew, my heroes changed, so that now I can honestly say that anyone who does anything to help a child is a hero to me. And I just want to say thanks to all these heroes, and I really mean it. So with that, questions?
Thank you, Becky. You're a hero yourself.
Oh, thank you.
Board members, let's take just a few minutes to ask questions. Hello?
If you can share, or I guess you can share if you want, but so you can see us,
I would love that, because thank you.
So first of all, Becky, you know that this was very helpful. I think I personally had lots of questions last meeting, right, 2 weeks ago, and that's why I requested something. And this it was a report here, and that's what I think people needed to hear, is just what is happening. And I think hopefully, for me at least, I can only speak for myself, I feel a lot more calm, a lot more, all those things, that because of this report, like in so many ways, especially about like understanding what was happening. I have one question. It might be a stupid question, but it's elementary level. So is there recess? I didn't really understand if there is recess or how, like what does recess look like? Because I know that, like, that was, like I said, I didn't really see that there, but elementary school recess is important.
It's so important, isn't it? So yes, there's resource and the recess, and the way we're doing it is the playground will be quadranted off and children will play in specific areas. So they'll be assigned to stay in those areas. And then when recess is over, they leave and they're actually going to go out and clean, sometimes in between, but definitely at the end. And then we even have some of our schools that have bought separate lanyards with, so that they are, the area they're supposed to be in on a specific day is labeled. It's very cool. So that's how we're doing it. You bet.
Other questions? Mohammed?
Rebecca, thank you so much for that wonderful slide. It actually, shed so much light on, the plan and the hard work that's been done. I too, feel a bit of a comfort and hope that we are heading in the right direction, slowly but surely. And at the same time, I hope and pray that, no COVID cases will come into our schools. And so I do have a question. One is in regards to meals. So they're going to be in the brown bags. Has there been have you guys taken into consideration the diet restriction, be it for religion or be it for health issues?
Yes.
How are you guys going to go about that?
Absolutely. In fact, and Kelly Orton has been to all of our meetings. I just love it. And he's the one who's in charge of food and nutrition. And that is absolutely taken into consideration with their planning. And even in particular, if a student has specific needs, they can contact the food and nutrition department and they help them with that. So that we absolutely want to meet those needs.
Fantastic. I sincerely appreciate that. And one more question is in regards, in the event of a COVID case at schools, what's the plan of action?
Okay, and we've got it all labeled out, boy. And I should probably just pick one of those guidebooks and send it to you. And I'll do that, okay? But it's all very lockstep, and actually HR and our nurses have taken care of that. So kudos to our nurses, and they've put it together in a flow chart, right? So if a child is ill, they go to the office and we have a separate room for them. Their parents are contacted. And there's even extra PPE that the people in the office can put on. So that is all, we all have it's very set as far as procedures and protocol.
Thank you so much, and great job on everything you guys are doing. Thank you.
Thank you.
Go ahead, Christy.
Becky, thanks so much for tonight. There's such a great report. Really appreciate it. And maybe this is more of a question for the superintendent. I'm wondering if we could have a report sent to the board of all of the school plans so that we can see what's happening in each of those schools. And maybe every board member doesn't want all 27 elementary plans, but maybe they only want the ones that are in their precinct. So we could request those possibly, just so that we will be informed and know what's happening. I think that would be really helpful to me, and not to speak for the rest of the board, but I would like to see if we could get that report possibly. Would that be okay, Melissa? Nate, is that all right to make that request? And okay, great. So for me personally, maybe you'll just want to ask each of us, Larry, what we want.
Okay, will do. Yep.
Okay.
Then Larry, I'm happy to help with that. I mean, I've got it all on a OneDrive.
Okay, we can coordinate tomorrow, Becky.
Okay. Thanks again. Thanks, Becky.
Go ahead, Nate.
Yes, Becky, thank you so much for bringing this report to us tonight, and for all the work of your colleagues and administrators and teachers that you're working with to make this happen and possible. I'm thinking that my question might be a little more directed to the superintendent and to Mr. Schulte. You touched a lot on a lot of really good information relative to academics, but I'm just wondering what the day-to-day life might be inside of the school. And I know we've made over $1 million of an investment in PPE, maybe even close to 1.5 million. And I'm just wondering, and Becky, if this isn't a question for you, if Paul or Larry could answer the day-to-day and what that might look like and what kinds of measures are in place to maintain, an abundance of caution and safety in our schools.
We have all those procedures in place in that guidebook, but I'm going to give it to Paul because boy, Paul has led the way on all of this. Go for it, Paul.
Thank you. One thing we'll do is Yandere put together the procedures to probably answer every question that you have, Nate, that she forwarded to all the administrators today after we met collectively with them last week. So I would recommend that gets sent out to you. But just in the meanwhile, a couple things that'll probably make everyone feel very, very good just going through the CDC recommendations and requirements is, first of all, airflow is really, really crucial, correct? One of the most important things we need to address. The CDC and ASHRAE recommended that we use MERV 13 filters. All the schools, with the exception where you got to scramble a little bit more for West because West needs so many, and MERV 13 filters, we're on back order like a lot of things are. We'll have those MERV 13 filters, all the elementaries before school starts next week. They're normally changed semi-annually. They'll be changed bi-monthly now. The other interesting part of that is that the challenge you have is that you want more filtration, but then it puts a stress on your mechanical systems to reach the standards also presented by the CDC and ASHRAE to increase our airflow. But we have done that. We've met that. We've worked with the consultant. Every classroom will be disinfected, and the little bomb, I always forget the right terminology for it, but they'll be bombed every week. The schools will be cleaned from top to bottom every day, 24 hours a day. Bathrooms will be cleaned 4 times a day. Playground at least 3 times a day. We have a procedure in place for all the classrooms with the disinfectant. So there's 2 different things. You have I'm getting a brain fart here. And then the disinfecting. So all the desks will be disinfected. We create our own disinfectant. I want you to know that we are ahead of the curve. Most of the districts in the state came to us actually before COVID came on board. And so we were very prepared. The CARE funds were able to help us. We generate ourselves, and we were able to purchase more generators. So that's just a little spot, light, but we'll send you that document, and it covers just about every issue that might arise, Nate.
Awesome. Thank you, Paul. I'm still waiting for my bottle of Schulte hand sanitizer. So no.
Hey man, it's on my top of my to-do list. I got it.
Larry and Becky, is there anything else that you might want to add relative to the day-to-day, moving in throughout the school and what classes, what they might be doing and what the classroom environment might actually be like as well?
Sure. I'll just say that Paul, some of the procedures that Paul has given us, and they go through all of the schools. As children walk in the morning, their desks will be sprayed, and they get to clean them off with paper towels and throw them away. Same thing happens a couple of times a day and at the end of the day, so that they're having that opportunity. It's completely safe. Paul says he can drink it. I haven't seen that yet, but
you actually can. That's why we don't have an issue. And this is really important, kind of a sidebar, but it's really important to understand because inevitably you could get a call about this issue. But the sanitizer that we create ourselves with our own generator is 100% safe. But it's also I guess nothing's 100% effective, but 99% effective. So literally a kid could drink it and you don't have to call any emergency room or anything like that. So that's why I think this is kind of sidebar, but it really is important that our comfort level is very high, that the teacher sprays the desk and the children wipe them off with a paper towel and throw them away. There's nobody in harm's way. And then isn't that great? We teach them responsibility to kind of take care of and have ownership for their own space as well.
Right. Another thing, you mentioned how much money had been spent on PPEs, but we have masks for students, disposable masks, but then also we have purchased cloth masks as well. So lots of PPEs available for students. Our teachers, also for our teachers have not just masks available to them, but they also have, okay, I'm having a mental blank, you know.
Face shields.
Thank you, face shields. Our classrooms have, you saw the picture on my slide, and that was actually one of our classrooms at Mountain View. No, was it Mountain View? I believe so. The plexiglass shields, the students have those on their desks. Teachers are teaching children how to walk down hallways. There are arrows that have been put up in buildings and signs put up on doors where kids exit, where kids enter. There are sanitation stations. Oh, every student has a water bottle, and we'll be using those rather than our drinking fountains. So many great small but important features that will help students, right? Going back to that well-being, students and parents feel safer.
Thank you, Becky and Superintendent. And Paul, please extend a huge debt of gratitude and thanks to your building services and custodial teams. I know a few of your folks on the custodial teams in our schools, and along with Becky's wonderful quote from Mr. Rogers, they're incredible heroes for us right now and always. So please extend that from us.
We'll do.
And myself.
Absolutely.
Catherine and then Jenny. Go ahead, Catherine.
Thank you for that report, Becky. And I want to thank you. I also want to thank the schools. I know this was a huge effort for them to put together those plans and to present them. And I really appreciate the SICs and the principals and the amount of work that went into this. So thank you to all of them. I have just a couple questions. The first is that when the survey went out to parents, I believe it included 3 options. It was stay remote, and return to in-person, and then also stay with your teacher.
Yes.
And so I'd love to see those statistics, because I think that would give us a better idea of how parents were voting, and then which if parents were allowed to stay with their teacher if they asked, or how many parents did get to stay with their teacher and how many parents didn't.
So I can get you that. I'd love to get you that information. I will tell you that we did have 3 questions, and I would say the majority, I cannot remember the exact number, but there was a large majority of parents who said, I want to stay with my teacher regardless of what happens. And principals did that.
Mm-hmm.
So that's
right. Great. That seems like that would affect the statistics.
Yes.
A little bit. So maybe quite a bit. So that would be interesting for us to know. Then the other questions I have are what are the plans that we have as a district to support our elementary schools if we need substitutes and we need people like substitute custodians, things like that.
Great. So we actually met today and talked about that in one of our meetings this morning. We've talked about that in our meetings on Thursdays. We're putting together a flow chart for our principals. There are a number of different ways that we can handle substitutes, and it is a concern of our principals. Of course, calling in for a sub, and then we're going to have to rely on each other when we can't find those subs. Be it whether we divide some kids or whether some of our remote teachers step in and we use our paras. People are going to have to be creative. It's just a fact. And we talked about that this morning. We work the problem, right? That's what we teach kids to do. And that's what we say to our administrators, but work the problem. And we are like I said, we are going to put in their hands a flow chart so that then they know they can go back and look to that, because it is a concern of our principals, of course, and of us.
So do we have a good pool of substitutes right now? What's our situation?
You know what? I cannot tell you. I don't know the exact number. And that was one of the things that we talked about this morning, is it would be nice to know how many people have actually applied. And I know that there are some subs that have been trained in Canvas. Tiffany, maybe, I don't know whether you can speak to that at all.
Yeah, we've had about 30 subs go through a training with Sally Warnicki, our supervisor for digital learning, and she's gone through Canvas, getting into Canvas, what Canvas looks like so that they can support and answer student questions and some parent questions, and then also how to use Zoom and do some of the features like breakout groups and different things like that. And MQuants has been great about making sure that all of them have access so that they can log in without any problems. And so that group is really set up and ready to do some online stuff. But like Becky said, we've been hearing, I'm sorry, Ms. Pinham said, we've been hearing a lot of really innovative and different plans in terms of ways to keep classes going and to use paraprofessionals and teams and different things like that. But we're working with the subs that want to be online subs as well as those that will still be in person.
Thanks, Tiffany. And just to go back, well, go ahead. I just wanted to point, Tiffany did say to let me know that 62% of our guardians said that they wanted to stay with the teacher regardless, either way. So there's an answer for you quickly.
So 62% of the people that answered the survey said that they wanted to stay with their teacher.
Yep.
Okay, so that would be that would probably really change those the statistics that you have quite a bit. So I think we should maybe take a look at those with that answer in mind.
Sure, and just so that you know, Catherine, of course we did that. Each school did that one at a time. Every parent and with those classrooms, they would look at them, and Tiffany's group assessment built this beautiful, incredible platform that did just what you're saying, so that principals could look at it and say, okay, it looks like the majority of parents want to be remote, and then that would be the default. And then from there, they would pull in anybody who on this side who had said they wanted to be in person but would rather be with the teacher. So those decisions were made early on, absolutely looked at. But I'm sure that we could get you some information from that platform so that you could see what the administrators were able to do.
Sure, that'd be great. And then the last question I have is, how do we have schools where we have side-by-side in-person classes, even though a chunk of people wanted remote? And what's our situation? Can we get a report on that? What's our hybrid classroom situation looking like?
Not quite sure what you're asking. You're talking about the expanded classrooms?
Yes, I'm talking about expanded classrooms.
Okay, great. So yes, we do have expanded classrooms, and it's about a third, and a third of of remote and in-person only and expanded. So there are about 30 expanded classrooms where teachers are saying, yeah, I would rather keep my children. And like I said, there may be there are probably, a few cases out there where a teacher may say, well, that's not really what I wanted to do, but that's what my team wants to do. And we're doing it as a team. And that was powerful. One of the powerful things in making these plans was watching these administrators go to every team. They were required to do that, to meet with those teams and work the problem, and to put what was best for kids first. So if you would like more information, I'm happy to get it for you. But those are the numbers, about 30.
I'd love to get more information. I'd love to see sort of school by school, grade by grade, like really getting into the nitty gritty. Where do we have remote? Where do we have in person? Where do we have expanded, which I think a lot of people in the community are calling hybrid.
And you probably can't see it, but I got that right here.
Perfect.
As of today. But I'm not going to give it to you yet until it's firm. Okay.
Perfect. Thank you.
That's if it's okay for me to give it to you, and I would assume that it would be.
Becky, I know you've been working around the clock like these principals, and I really appreciate it. And I just hope that you all can have a little bit of a rest the weekend before school starts. So thank you so much. Thank you to you, and thank you to all of our elementary principals.
Yeah,
I want our elementary principals and our elementary teachers to know how much we value you and how important we think you are, and that your safety is really important to us.
Absolutely.
Thanks, Catherine. Go ahead, Jenny. Sorry.
Oh, you're fine. Can you hear me?
Uh-huh.
Yeah. All right. I just want to echo the same sentiment that my colleagues, my fellow board members have said in regards to what you guys have been putting in, Ms. Pitnam. With that same vibe and passion that you've given, I've also seen it with my own eyes visiting to, certain majority of the schools in my precinct, and they're in accord of trying to get together and work as a community and unify, this team for the betterment of what is happening. And I truly express my gratitude. I do have it's a concern, or actually, like Joel, maybe a dumb question, but
Dumb question.
you guys have a protocol. If a child does test positive, right? And during that protocol, what is in place for mental health? Because to pull a child out in front of everybody with PPP, where, like, how
Yep.
what are your
and
process for that?
Thank you for saying that. So we wouldn't be able to test them at school. It would just be that they started to feel ill, or they got sick, or one of the symptoms, right? So we would treat them the same way we would treat any dear child that threw up. And if you've ever been in an elementary school, boy, it happens right on your shoes. and you show them lots of love. You try and protect them and protect their privacy. And then you would bring them down to the office. You wouldn't just send them. So they're taken care of.
Okay. Thank you, guys. Thank you once again. Awesome job.
Yeah, Nate says lots of ice to be handed out, and that's the truth. If you've ever worked in an elementary school, you practically just need a freezer. That's it, a freezer just for the ice bags but they're magical. An ice bag will cure anything.
When I worked at South Kearns Elementary in Granite, my office was in the ice room, so I handed out a lot of ice.
I love it. All right, Dottie, let me give you the concluding speech if you'd like. Questions?
Yeah, sure. Thanks for that, President Ford. So I think I was going to ask a question, but your last comment, Ms. Pittam, kind of clarified that, which was about testing. So is my interpretation that the school district has no testing done on a district-wide basis for elementary students? Is that correct?
So I'm going to shoot that to Larry.
Testing is available through the Salt Lake County Health Department now, Monday through Saturday. And so any student can go get tested any day.
Okay, yeah. So I'm wondering if you've looked towards any other testing strategies where you administer a PCR test in a classroom. I know that those are really expensive, but you could do a pooled test, like to pool a classroom and then have them all submit a PCR sample, mix it up, and then test it once. Have you looked towards any of those testing strategies?
Not that particular idea, but I have talked to Dr. Hirsch, and I believe we can start to do some testing through the HERO program. So, and actually, I think they're pretty open to creative ideas. So we'll see what we can get out there.
Well, that's what I like to hear. Thank you so much.
Thank you.
Well, thank you. You can tell that there's an immense amount of work that's gone into this. Thank you for making it happen. Much appreciated. All right, let's move on to the next item on our report agenda, the district office rebuild. Alan?
Yes, so all board members should have received a copy of some building plans. Those plans were drafted up about a year and a half ago, probably. So we have Executive Director of Auxiliary Services, Paul Schulte, is here, and he has a couple guests I will let him introduce, and we're going to do a brief walkthrough of those plans with you.
All right, it's wonderful to be with you. I'm excited to get to know new board members. President Ford, thank you for a few moments. We'll try to expedite things. I have with me Todd Palaga, who's my assistant over Auxiliary Services, and then we have two members of our team from NJRA Architects. I'll have them introduce themselves briefly.
I'll go first. Thanks, Paul. My name is Tiffin West. Can you hear me?
Yeah, Tiffin, use your big person voice, it's a little louder.
Oh, shoot, I don't
There
have
we
a
go.
big person voice. Anyway, my name is Tiffin West, and I'm with NJRA Architects. I'm not sure if Selvam's here.
He's back.
Yeah.
We got Selvam
Okay.
back.
Hi, my name is Selvam Rajavelu. I'm with NJRA Architects. I've been with NJRA Architects for 30 years. We have designed several elementary schools for Salt Lake City School District. This is a very exciting opportunity for us, and Tiffin will explain the progress, what we have designed so far. Thank you.
And before I go over the floor plans, I just want to give you just a brief history of how we got to where we are, and then a couple bullets of things to maybe think about as we're walking through the plans. We actually hired NJRA in the spring of 2019 and actually began the design process in May of 2019. It's been a collaborative process throughout the entire time. We met with every department at least once in depth, and then they also had an opportunity to review the plans, the tentative plans as a group. We also tried to reach out to the board. We met with a few of you who were able to come. Of course, we have a different board now as well. Then the original timeline was that we would have begun the construction last year during the summer. Obviously, with the change of leadership in the district and COVID, 2020 is anything but normal. And so I think wisely, it was delayed by the board. I do want to bring you up to speed that so far there's about $800,000 to $900,000 that's been invested in the design process from district funds. In addition to that, Nate asked a great question last fall when we brought it up. When the resolution was adopted in June, we did meet with our different engineers and departments and made some adaptations to the plan to better meet the needs of the resolution. Because if this building is built and if we get permission to proceed, it'll be the first building we will build after the resolution. Couple things to keep in mind. If you were to, I know that each time we've talked about this, and I think wisely again, there's been a concern about we would like the new superintendent, she or he, to weigh into the plan. I would interpret that to be that wouldn't be wholesale change, but maybe they would want to maybe fine tune and massage things. If we were to go to bid, let's say in the spring, there is a lot of work that needs to be done before we would ever start building the building. For instance, we have to do an abatement. So the asbestos needs to be removed and it has to be demolished. So we would be looking at, we wouldn't ever really start digging the hole to build this building until next October at the earliest, if we were given the green light. And let's say we moved out of the building, started tearing it down in June, which we interpret that as the new superintendent would have quite a few months to weigh into it, and we would be able to adapt any particular changes. That's assuming that we just didn't throw the whole plan out and start over. But if there were things that we wanted to massage in the plan, we would have time to do that if you felt comfortable. I would say also two other things, and then we'll go right to the plans, is we do feel like based on the market in the area that this would be a good time to consider this spring sometime if the board felt so inclined, because certain projects like the airport and things are coming off and finishing. And so there's more desire to get some contract work. And the other thing is we planned on, with our capital plan, being out of this building. To stay in the building another year, there are systems that we need. The spring really concerns me in the summer. So we anticipated that we'll need to invest another about $600,000 to $700,000 to stay in the building for another year. And one additional thought, we obviously, if we do this, have to come up with a plan where to place folks. Like the pandemic and like many people have said, we've learned a lot of things. And so the amount of square footage that we might need to put our folks together could be significantly less than what we thought of a year ago, because now we've learned that a lot of folks can work remotely. And so it will kind of change maybe our approach. So just keep those things in mind, and I will, Larry, you have to empower me to share the screen.
Okay, you should have it.
Okay, now let me make sure. Okay. Does everybody see the plans?
Yeah, we can see them.
Okay, Tiffin, you've got the mic.
Thanks,
And
Paul.
then we'll take questions at the end, obviously.
This is just a rendering image of our preliminary design. The front of the building, which is facing 100 south. So go ahead and keep going. So just quickly going through the plans. The building consists of a 2-level parking garage below 2 levels of office buildings. So this first plan that we're seeing is the first level of the parking garage. On this level, there's 115 parking stalls that are shown in white. There's an entrance and exit on the south side of the parking garage. In blue, there's some storage rooms, a receiving and unpacking room, and then 3 enclosed stairwells up to the office building. There's also an open stairwell on the southeast corner that leads up to a plaza that's above the parking garage. Next level. This is level 2 of the parking garage, so this is right above the level that we were just looking at. On this level, there's 109 parking stalls. The entrance and exit is on the east side. In blue, there's mechanical and electrical spaces that are support areas for the main building up above. And there's also 2 flexible classroom type spaces that have restrooms in the southwest corner there. Again, there's 3 enclosed stairwells up to the office building and an open stairwell down in the southeast corner that leads up to the plaza. Next slide. So this is the main floor of the office building, which is just above the level that we were just looking at. The main entrance is there on the corner, and that's from 100 South. Superintendent's office, boardroom, 3 professional development classrooms are down there in yellow. So those professional development classes would open into a larger space for board meetings to house the audience for board meetings. Over on the north side, we have the Human Resource Department, the Development Department, Business Administration, Payroll, IT, Communications, and that's it for this level. Oh, and Policy and Legal is down there by the boardroom. In white, are all the support spaces. So there's shared conference rooms, team rooms, break rooms, and restrooms. And then you can see there's an outdoor plaza, which we'll get into a little more when we look at the site plan. But that is in line with this 3rd level, which is the main level of the office building. And then there's an outdoor patio on the north side that the break rooms open out to. Sunlight, our main concept for the design of the building is that sunlight will come through the south side windows, right along where Paul's pointing to. And they'll come through there and into the open office areas and the little lounge area that you see in white that's right against the glass. So we're trying to allow for as much natural daylight, views of an outdoor plaza, and those types of things for the wellness of the staff, people who use this building. Next slide. This is the final level. This is level 4, which is the second level of the main office building. On this level, you have the department's special education, ELP, teaching and learning, assessment, student services, equity, digital learning, and school leadership and performance. Again, the support spaces are in white, and those are break rooms, conference rooms, team rooms, storage and work rooms. And I think that's all for this level. This is a view of the site. You can see the office building in orange. And so those are the upper 2 levels that we were just looking at. The visitor parking is off of 100 South up there on the north side, and they can enter in the main entrance, which is there on the corner of 100 South and 4th East. Driveways to access the parking garage are on the east and the south sides. Delivery parking and unloading zone is on the south side of the building. And then you can see the outdoor plaza, which is directly above the parking garage. And then the patio in front, which is also above the parking garage. And that is an overview of the plans.
We're open to questions.
Thank you, Paul.
Maybe there
and
isn't.
Thanks for this presentation. If you can stop screen sharing, then I can see board members.
I'm sorry.
This is on report,
go.
so I'm going to open it to board members for questions. Hoali?
Just go first real quick. I have questions always. But it's good to see this. I know that we were, I've heard about the reports about this topic in the past. So it's good to see where it's at, and especially with what you said in the beginning, it's like, the new superintendent should have a input, but things could still be moving in certain ways, right? So thank you for this report. One question I have is, I'm a big, and I've heard this a lot from the students too, about environmental issues, right? Is there like, it doesn't have to be, you don't have to answer it today, but there might be in another report, like the environmental aspects of this. How is it efficient? Is it carbon neutral? Like all these different things like that are there. And I'm sure you might not have the answers right now, but how is the environmental, especially with the city? I know that's a big initiative of building new buildings in the city, and how that's related.
Actually, we've done some work with that. When the resolution was adopted, like I said, we brought back our engineers and we retooled quite a bit of what we're doing. One of the main reasons for that, for those windows is that issue. We have got a certain efficiency standard that we tightened up even more so. The biggest thing that I will be transparent about in our strategy is our boiler and heating will be natural gas, with understanding that we have that 2040 goal, and that will make the transition at that time because of the price and the cost of energy, which we'll be addressing. But we did double the cost of the electricity, and running those electrical boilers would be enormously expensive at this time. But We know what the life cycle is of that, and we plan on incorporating that relative to the resolution. We did double up the size of our solar array as well in response to the resolution too.
And
like I said, the systems themselves were tightened up as well. So we went back and sharpened our pencil after the resolution was adopted.
That's good to know. Thank you. And then my last question is just, I'm an artist myself, and I know when it comes to buildings, if there's any like white walls or anywhere that's already designated specifically where youth, because I know this building has art from our community and youth, so if that's a thing that could be there, with whether it's just that patio or even inside the building, any art that could be painted directly on it or just be designated for that.
Yeah, I think that would be something that we want to maybe put to a committee together to collaborate with our architects.
We have actually established some areas outside of the professional development boardroom area for art. We have some lighting and some special wall backing, and it's ready for whatever you want to look into doing. So
great.
Yeah, I'm going to use a word that Howell loves when I use it. I'm going to dovetail a little bit on what Howell said. Are we searching or reaching for any level of LEED certification relative to points in this project?
Great question. Our strategy has been to take the best of LEED and incorporate it into our planning, and take some of the constraints that LEED sometimes incorporates, and not go for the actual LEED certification, but steal their best practices and incorporate it into the building. Do you understand what I'm saying? I don't know if I'm not trying to talk in code here.
No.
When we talk about sustainability, we're trying to take those standards and apply them, but not some of the paperwork components of LEED. They sometimes put constraints on you rather than enhance you. So relative to the resolution and sustainability, we're trying to take, no pun intended, the lead from LEED.
Understood. Thank you.
Other questions, comments? Catherine, then Christy.
Thank you, and thanks for this report. First of all, I thought it was really interesting what you said at the beginning, Paul, that these plans were in effect for a year and a half, and that we've had them and we had plans to move out and things like that were stopped. Because I do want to point out, to correct the record, that I asked those questions if we had plans ready of the former superintendent and the former business manager several times, very specifically in open board meeting approximately a year ago, a little bit less than a year ago, and was told no. So I don't blame anyone here, but I do want to correct that record and point that out. I think that's really important, that was the, yeah. And I certainly don't blame any of our employees who were taking the lead, speaking of lead, but didn't want to say that. But I do think it's really important to point that out. I love the sunlight idea. I think that's wonderful. I like the idea of LEED certification. I think that maybe we should explore that a little bit and see how limiting it would be to try to do maybe a silver LEED. Maybe we don't have to go for the gold standard, but we could go for the silver standard. This building in many ways is very similar to our current building. It has more sunlight. It has that wonderful plaza. It has parking underneath. And I don't blame the architects for that. I think that was probably the instructions they were given. When the plans were delivered and I looked at it, I was disappointed. I'd like to see innovation if for new building ideas, for the opportunity for people to do more community building and exchange ideas. I think buildings can sometimes promote that. And in a way, with our departments, the way they are sectioned off, I think that it will do less of that than we could do. Like I said, I don't feel as though this was a problem for the architects. I think that they probably were following the instructions they were given. So it's not a criticism meant for them. The other thing is that I have made the point, and I think other board members supported me when we were talking about this building many times, that we don't have enough places for testing in our district. Granite School District has one of its retired elementary schools completely dedicated to testing, is my understanding. our schools, at least West, must use PE space, PE gyms and things like that during our testing period in May, which kicks the athletes out, or the PE students out. And with the table set up, they can't really use the space after school either, unless all the tables are taken down. So one thing that I requested is, since we don't have dedicated testing space, that we think of someplace in this building, maybe a top floor that could be used. And at the time, we were talking about, the superintendent mentioned they could also be used for things like our collaborative learning, big meetings that we have for things like that. We don't have space in this building for those kinds of things. I strongly encourage us to think about that. I think that the space is also a problem at our other schools during testing. I don't know the details as much, but I think that's a really big deal. And if we could have a space that we could section off, some more than just the boardroom, which looks about the same size as our boardroom, which is not enough space and also not able to be dedicated for things like big teacher training times and testing times, that would be really important. Finally, I think that I do not plan on being around for long after this building is built, but I really think the board needs a space of its own to meet with people, maybe a few meeting rooms. I also suggested this, and possibly space for a board administrative assistant. And so that was something else I suggested. I think the board members really need to think carefully about what we need as board members as we go forward, to meet with constituents at the district office, usually where we have to meet with constituents at places like cafes. But having a little dedicated space, dedicated meeting rooms for board members to meet with constituents would be a really great idea down at the district. So those are some things that I'd like to see incorporated in the building. I would like to see a building. I did get a text. I haven't really been able to read my text, but I did get a quick text from someone in our district who's married to an architect who thinks that it could look more beautiful on the outside. I can give the specific feedback later. Like I said, I think that the architects were following directions. So this is not meant as a criticism for you. Thank you very much.
Thank you.
Christy?
Thank you so much. So first, I want to respectfully disagree with Board Member Kennedy. There were multiple meetings that were held at our district office where employees were able to look at the plans, and the plan had been to come to the board meeting. So there were plans, and we know that there were multiple meetings that were held. I would also just like to encourage us as board members that we shouldn't make disparaging remarks about the previous superintendent or business administrator, because they are not here, to defend themselves. So I think that, moving forward is the best thing for us. And so I would just continue to ask us to do that. In front of us, we have these amazing plans, for a building that we have been planning on for a number of years, and we have put it on the back burner for a number of years to deal with a lot of the other issues that we've had in the district. So Ellen, I would really like for our new board members to hear, about the financing of this building, that we have put aside money that we can pay as we go. But could you talk a little bit about the cost of the building and how we're able to do that? And then just walk us through that so that they'll have a better sense of how, we've been able to come to this part.
Yeah, and if you're okay, because that's the next.
Would that be more for the next
item
one?
is the long term,
okay.
And that's where I can.
Okay, I wondered if you wanted to kind of mix that in together. Okay, that'd be perfect. So, Paul, I just want to say thank you. I think that everybody has been really thoughtful, and one of the meetings that I sat in when I think it was an employee group, and they were talking about, what they wanted the building to look like and the different spaces. And all of that feedback has really been put into these plans. And so I think, what Joelle Lee said about art was definitely something that you all have talked about. So I think it's wonderful, for us to always be looking at the art. And as Board Member Kennedy said, if there's any way that we could always make our buildings more inviting, that, we always need to be looking at that, because that's so important that it does look inviting. So thank you for the great presentation tonight. I actually didn't get the plans delivered to me, so Alan's going to get those, but I appreciate you having the presentation so that we could look at it. So thanks so much to your team and to you and for all the work that you've done.
I'll shoot you a PDF of the plans as well, Christy, before, so you'll have those as a stopgap.
Hey, thanks so much.
Thanks. And Paul, maybe you could send a PDF out to board members who might prefer to have it in that format, and
Okay.
and appreciate it being dropped off as well. All right, I'm going to give Mohammed or Jenny or Dottie, if you'd like to have something, you have something to comment on these plans. Go ahead, Mohammed. Good. Awesome. All right, Catherine, go ahead.
Thank you. I just want to respond to Board Member Sweat with all respect that I'm just correcting the record in board meeting that was said. So that's just what I wanted to do. I asked that question very specifically in a very directed way. And so I just wanted to correct the record on that. I think it's really important that we have that record corrected. Thanks.
Okay. So Alan, Paul, have you heard from board members? My comment would be just thank you for all the work you've put into this. I think you're hearing that there's a willingness of the board to move forward with the opportunity for the new superintendent to weigh in as we get to that point. This is just a report, so I'm hoping you'll bring it back to us at your recommendation for us to take action on, unless you need something more than what you're hearing from us tonight.
And just, I'll let Alan finish up, but just as a point of just to recoup and not to, to draw lines or anything, I want to make sure that everybody understands we can't fit everybody's need, but every department collaborated with us throughout the entire time. Whether, and I've had conversations with certain folks that aren't, quite happy, and it's hard to, please everybody, but we did do that. In addition, the meeting that we did set up a meeting with the board member and board itself, and I know everybody's busy and it's hard to get a perfect time for everybody, but we did have several board members show up, and then we did have another time where we laid out the plans that you're seeing tonight, maybe 5% less, but for the most part, exactly what you're seeing tonight, that we invited all the employees and the board members to be there. So our efforts have been to collaborate with everybody, to have all stakeholders and embody what I call the Salt Lake City District Way, which is shared governance. We've tried to keep everybody in the loop. We've made a good effort to try to do that. And obviously we have some different folks here now too. So, but the superintendent definitely would have time if we were to move forward, if we bring it back to make some, massages and adjustments too. That's well within the capabilities. I'll leave the rest to Alan.
Thank you, Paul. And as we transition to Alan, I think we're transitioning to the long-range capital plan part of our reports.
Right.
Thank you, Alan.
The attachment for this portion for this report has two schedules. Let me just start by saying, of our property tax levy, there's a portion of that levy is called the capital levy. So that's property tax that we receive that can only be used for capital type expenditures, buildings, infrastructure, etc. So it's called the capital levy. So what you're seeing here on these two schedules is the money generated by that capital levy. The first page of the schedule shows some history. So it shows some actuals for 2017, 18, and 2018, 19, and 19, 20. And then it goes with a revised budget and a proposed budget for next year. And this is kind of the first steps of the budget process. And you'll see these schedules again in the future when we have finished the budget book. But this is kind of like step one. So on these schedules, I really want to highlight just 3 lines of these schedules. First line is under the revenue section, property tax. So here's the revenue generated by that levy. And for the 21-22 budget, what you're seeing is we will have some of our debt is maturing this year. So we have what's also a debt levy. So the proposal in the budget will be to move the tax revenue from the debt levy that we are receiving over to the capital levy. Now, in order to do that, we'll need to hold a truth in taxation hearing. And that will be held in August, if that's how the board wants to proceed. but that you can see that jump in the property tax from the 2021 revised budget to the 21-22 budget. That jump there reflects that capturing those monies that we're currently collecting for debt service and moving them over to capital as the debt will mature. It will be paid off, that piece. If you also look on the second page, that situation also again arises in 23-24, and then it arises in 25-26. Those are the last two times with our current debt that we pay off a bond. So you'll see we'll have those same situations going in the future to make the decision of recapturing those debt monies and moving them over to capital. If you look under the expenditures under the line contracted service construction. So here's where we separate out our big construction projects. So you can see in 2017, 18, 18, 19, there's some big dollars in there. That's your Meadowlark and your Edison schools that we were building during those times. And then you can see it quite a bit drops off. But in the revised budget for the current year and 21-22 budget, and then projected for 22-23, we see that ramp up a little bit. Those are the expenditures for the district office building. Right now, we roughly have in there about $22 million. And you see after that in 23-24, that drops to zero because as of now, there are no solid plans for major capital projects going forward after this district office. And then the last line I want to draw your attention to is down in the bottom section, the fund balance section. There's a line, it's under the restricted section for capital projects. So what this is money that we've collected and saved basically in the bank that we're going to use for future projects. As you can see, that it kind of goes up and down. When we don't have any projects going on, we build up that savings. So when a project comes about, we have the money on hand to pay for it. And then you'll see that go down as we complete those projects, and then it builds back up again. And so that line really tells you, especially after 22-23, when the district office building would estimate to be completed, you can see how much money we are projecting to have in the bank to pay for future major capital projects. And that just gives you an idea of where we're going, how we're saving those funds, and what we do have available for future projects, or what we, if our future projects as we discuss them and going forward are more than that, then we have to look at different options for financing or paying for those. So those are the schedules. Again, we'll see these schedules again as we get you the budget book later in the spring. These schedules will be on there. But that's my presentation, and if you have any questions, we'll take them.
Okay, board members, questions for Alan? All right. That was a thorough presentation. Thank you, Alan. I think we'd like to bring back the district office for maybe at our next meeting for the board to vote on, take action on. Thank you. All right, we will move to the discussion agenda, which begins with the secondary in-person option. Superintendent.
Thank you, President Ford. Let me share my screen. And we will begin at the beginning. Okay, this is our revisiting of the secondary school plan. First thing I wanted to do was give a little update on the vaccination clinics. We started last Thursday with the vaccination clinics at Highland High, West High. I went by the vaccination clinic at West High, and it was actually fun. It kind of reminded me of waiting in line at the Olympics. Alan and I were both outside for a while. It was a little bit cold, but people seemed like they were in very good spirits and very excited to start to get their vaccinations. I want to send out a special thank you to Sam Quantz and Mindy Holmdahl for setting up the invitation system and making this all happen on a really short timeline. From the time that we knew how many doses we were going to have, the turnaround time was very, very short, and being a first pass, I think they really did a wonderful job of setting it up. We followed the same plan as all of the other districts in the county. And so that was to go from oldest to youngest by age. So, and that's how the invitations went out. When the invitations went out, folks did have the option to defer. They could defer to the end, or they could defer for a week. And so we send out invitations again this week, again with from oldest to youngest. We ended up giving about 850 vaccinations. We were allotted 800, and there ended up being a few extra doses at both sites. And it was at least 850, maybe slightly more. And this is something that's been seen in the past with vaccinations, is when they get down to the end, there does tend to be a little bit of extra as they give the doses. And so we used every single dose. We didn't leave any doses. And so in a situation where we had where we had all the appointments filled and they were done, if there was a parapro that was helping out or whoever, we made sure that every single dose got used. So 800 doses was our allotment the first week. That allotment was relatively high because they had put off the 70-something group to this week. And so this week, the number of doses that we're going to get is 300. And it's estimated that we'll get 300 each week moving forward. But I think that's also with the understanding of that's where we are today. And, a couple of weeks into this thing, things could be different. Who knows? Maybe the federal government will send more doses. There's not an expectation that they'd send less. The commitment from the health department is 3,000 doses a week to the county, of which we get 10%. So 300 would come to Salt Lake City School District. I want to just note a couple of pieces from two articles that I recently came across. One was from the CDC. Another one was from the American Academy of Pediatrics. These are newer pieces of research, and I would note that both of these pieces of research were done before we had vaccinations in the discussion as well. But I'll just read this, and this is, like I said, just excerpted from this article, which you can access from the information at the bottom. But as of the week beginning December 6, aggregate COVID-19 incident among the general population in counties where K-12 schools offer in-person education, and they give the number per 100,000, was similar to that in counties offering only virtual online education. The second two pieces are from a yet published, it's soon to be published article from the American Academy of Pediatrics. This was relative to a study in, I believe, North Carolina. But from their study, their data support the concept that schools can stay open safely in communities with widespread community transmission. And then secondly, their cohort study demonstrated that enforcing mitigation policies such as masking, physical distancing, and hand hygiene resulted in minimal clusters, or outbreaks is, I think, the terminology that we generally use here in Utah, infection and low rates of secondary transmission in schools, and did not cause a larger community infection burden. So based on that information and where we are in the process, I'm proposing that we start to offer an in-person option in secondary schools beginning on February 8th. That would be Monday, February 8th, not 3 weeks from yesterday. The secondary's in-person option, so schools would continue on their current schedules. Wednesdays would continue as asynchronous days. All classes would continue on Canvas. Secondary students that desire an in-person option would have the option of coming 2 days a week. And to keep the total number of students low, to maximize our ability to social distance, students would attend either on Mondays, Thursdays, or Tuesdays, Fridays. And this came out of conversations with our administrators in both middle schools and high schools. And this is what we finally settled on. And we would do the same for both middle schools and high schools. So it was consistent within a family that had students in both middle schools and high schools. For the high school, this is high school specific. To further keep class sizes small, students would have the option to choose remote or in person on a class by class basis. So a student that was, say, on the in-person option where they came on Mondays and Thursdays, that student might choose to come for their 2 periods, the first 2 periods of the day on Monday and the first 2 periods of the day on Thursday, and do the other classes remotely in the afternoon. So this will help us keep classes even smaller than they would be just on the Tuesday and Thursday plan. Teachers would take role in the same way. They would have all of the students either remotely or in their classroom at the time they were doing the teaching. This is relative to outbreaks. I know this has come up in the past, and we've talked about this. This is directly from the COVID-19 manual from the state. So an outbreak is when a disease happens in higher numbers. This is relative to the question of closing. Classroom specific, the recommendation was 3 students. That's for elementary only. That recommendation doesn't stand for high schools. And then whole schools to shift to remote would be 1% of the population, or 15 people in schools that are lower than 1,500 in population. There are a lot more details that go along with all of this. And I can share with all of you it's accessible, but I can share with all of you the COVID-19 school manual from the coronavirus utah.gov. And it's got all the details, but I would recommend that this is the area that we start at. That is my complete presentation.
Thank you, Superintendent. For the purposes of this discussion, and given that this is an item that we may choose to take action on, we'll just set some ground rules per our training this last week. Again, every board member will have an opportunity to speak once before a board member speaks twice. I'm not going to limit this discussion. I want to make sure you feel heard and have your questions answered. And then we'll look for a motion potentially to move this to action at the end of discussion. So with that said, let's go ahead and go around the table with questions. Hoel Lee, do you want to start?
Yeah, I can start. And just just to reiterate what you're saying, in terms of just the procedures, each of us will be able to share, but after the first round, then the only motion we will make would be is to move this to action. And then we could actually go into detail about the proposal if any amendments need to happen.
That's exactly right. Then
Okay.
we'll take a motion and we'll discuss amendments and whatnot at action. But for
Action.
now, we're discussing the superintendent's proposal.
Okay, cool. So thank you, Larry, for that. Especially from 2 weeks ago, there's a lot of good details in the whole proposal that was there. Glad a lot of it continued and even was built upon of it. The asynchronous things I really think is a good idea. I think you made it even more clear that let's say even 100% of the students want to go back to West High School, right? Let's pretend, right? That's not actually the number, but if they do, they'd actually would only be able to go into West 2 of the days out of the 5 days of the week. And just to make that clear. And so that reduces it. And maybe they, like you said, not all of them want to go to every single class that day, which even reduces the numbers even more. And so that's good to know and hear, because yeah, that was a big concern of just some teachers. And when I was a teacher, there's just like 40 plus students, and so just knowing that number is decreasing is good to know. So I'm glad you put that. Especially I was at the SEC last week, I think. The days mixed, but for West, and I learned a lot about what West High is doing specifically. It helped me, and I think that was reflected here in your proposal of like what the principals are really leading and what they've talked to their staff and what's happening and possible in terms of being flexible and just like you said with the students. And the biggest thing that I think my biggest takeaway is we are finally providing an option, an in-person option. It is of course limited because of just the safety, Oh, did I? And then, but yeah, I think that's the thing that I'm seeing there. Did I freeze? I don't know if I froze.
No.
Okay.
You're good.
Okay, I think cool. That's it. I didn't even have any questions in terms of that, but like I said, later when we're in action, I can go into them.
Thank you, Superintendent, for, doing all this work for, for something that we've been going a few months round and round for. So I appreciate all the work that you've put forth. I do have, what does it look like what does it look like for teachers on this option, this in-person option? If we could clarify that.
Yeah, we can. So as a starting point, what we want to do is, I mean, we really want to make this, we want to make it doable. And so a teacher is going to teach their class with the same methodology that they're doing now, but students have the option to be in the classroom. We have a lot of creative teachers. They're going to figure out how to make that work best for the students. But essentially what they're doing is the work they're doing now, with some students having the opportunity to be present. So they might make groups within a classroom that could include some of the students that are in person, some of the students that are remote, or any creative way that they can come up with. That also allows, again, so it allows a student to actually make the choice on a day-to-day basis whether they attend in person or take a class remotely. So I might go to my math class on Monday, and I might decide that on Thursday I'm going to just do it remotely. They would have that option.
Okay. Thank you. Would this, if the student picks the 2 days, right? Say if the student picks Monday or Thursday, and they decide, oh, I can't make it that Monday or Thursday, are they given the option to, oh, can I jump in on Tuesday or Friday?
I think what we'd like to do is set it up by the alphabet. And then if an individual school works with an individual situation, they always have the latitude to do that. So, I mean, if it's a one-off here and there, I would leave that up to schools' discretion.
That's all I have.
Sorry, go ahead, Catherine.
We're going in order, is what you're saying right now, in board member order?
Yes.
Okay. So I've heard a lot of legitimate reasons about why we should be sending school children back to classrooms. We know that a lot of them really flourish in classrooms in ways that they don't do remotely. So perhaps we need to discuss what sort of risk is worth sending our children back to school, because there will be COVID transmissions when we return, because transmission occurs in schools, and we need to accept this fact. I think we need to just stop discussing whether the virus is transmitted in schools. For too long, the narrative has been that somehow school is a magic space where the virus doesn't get transmitted, and we know this isn't true. We can see this week after week in the Salt Lake County Health Department data, just based on that alone. The Salt Lake City School District, with 38 schools, let me just see that the numbers are, I have them right up here, are the Salt Lake City School District cases in the last 2 weeks were 24 for our 38 schools. Murray, the next closest district to us, has 10 schools in terms of cases. They have 50 cases. So 10 schools, 50 cases. Their total number of students are not a quarter. Actually, they're more like probably they have about 4,000 students. So less than a quarter of our community. So they have private schools, for example, have 36 cases. So every single one of these districts has more cases than we have. We have the fewest. So I think just that data shows us that transmission is happening in schools. And it's been consistent the entire fall. Salt Lake City, the county website has provided evidence that staying remote does indeed prevent school transmission. Some people want us to believe that transmission doesn't happen in classrooms when people are masked, but that isn't true, and it'll be less true when the new variant spreads widely, which they're expecting to happen sometime around the end of February, beginning of March. So some people are arguing that these transmissions are not happening at school, they're happening via extracurriculars. That's not logical either. We do indeed have transmission going on in our extracurriculars. Most of our cases, I believe, are from either adult to adult transmission or extracurricular transmission, which is happening on many of our sports teams. We're getting some reports of that, and I just want to remind our superintendent that we're supposed to be getting all the transmission reports from sports teams. I'm sure you are doing that, but just as a reminder, because I know there are a lot of things on your plate. Other transmissions are happening also between adults and schools and between adults and children in small groups. We know this from our own employees that have had this happen, adult to adult transmission and child to adult transmission. We've heard about those cases in emails. We've gotten emails about that. They're anecdotal, but we know it's happening. Transmission occurs in schools, and we need to accept that fact. The county health department will not send us data about adult transmission in schools, or if it has, since the last time I asked in December, the data hasn't been shared with school board members. But we know, go ahead.
That data, there is not data on it.
Right, thank you. We like I said, we know it's happening between adults because we have that anecdotal data. I know a person who did get COVID from another adult at a school, and when she was there in person, and her husband got it from her before she knew she had it, and he was severely ill, and I was very worried about their family. We also know that between this meeting and our last meeting, a Salt Lake City School District parapro died from COVID. He'd been working daily with small groups of students before he got ill. Community transmission is so widespread that our county is not doing contact tracing, but people who knew this person, the person who died, not only thought he was amazing and wonderful, completely devoted to students, but they also believe that he contracted COVID from working with small groups of students in person at a school in our district. Transmission happens, people get sick, work days are missed, hospitalizations increase, a few people end up in intensive care, and occasionally people die. Very rarely children die. However, right now, Primary Children Medical Center is full of kids with MIS-C, and they're up more than 5,000%. That's not a misstatement. They're up more than 5,000%. In addition, we don't know what long-term effects children will suffer from contracting mild or asymptomatic cases of COVID. Among many of these effects shown in the elementary school population, some of the most recent problems we've seen from recent studies are blood vessel damage, regardless of disease severity, and including asymptomatic children. It was a relatively small study, and they plan to do additional research. But in this study, 86% of the students met the criteria for thrombotic microangiopathy. Other students show that children are at risk of infertility. Another very large study done in Oxford in November showed that 1 in 5 COVID-19 patients developed mental illness within 90 days. These sequelae, which become lifelong negative impacts that accompany COVID-19, along with many other impacts on patients' hearts, lungs, kidneys, and other organs, are enough to make me ask why we're so eager to send children back to school. We do know it benefits them, but what about these long-term health effects that'll carry with them for their entire lives? In our public comment time and often in emails, people refer to Dr. Dunn and Dr. Hirsch and their choices. These two wonderful doctors are certainly experts. However, they do not send their children to our schools. You cannot compare their schools to our public schools. Roland Hall, for example, has their high school students in 2 groups like we plan to, going a week in person and a week remote. This probably means they have an average of 8 kids in a class at a time. If we divide our classes, as the superintendent has proposed, I think that's a good proposal, some would still have 21 kids in a class. In addition, I've heard that Roland Hall, McGillis, and Madeline Choir School have all had to move classes and entire grades even to remote learning because of COVID exposures. They have had incidents too. Schools are not magic spaces. Transmission occurs in schools, and we need to accept that fact. If we can get beyond that discussion, we can address other things that impact our decision-making. For example, I'd like us to speak transparently in meetings and hear answers about how the legislature has tried to influence us. not only with teacher bonuses, but also with threats about decreasing funding through other methods. We might want to remind some of our legislators that because we have kept our schools and thus disrupted COVID transmission, because we kept our schools remote and then thus disrupted COVID transmission, we have left spaces in the hospitals within our boundaries for their constituents who need those beds. Right now, ER COVID beds in Salt Lake City are 101% full, 101% full. We should speak transparently in our meetings about the 8 sets of parents, most of all of whom are not part of our minority majority population, all of whom are highly privileged, and the lawsuit that they have filed so that their students can return to school, and how that influences our decision-making by board leadership and superintendents, especially if some of those people are friends with some of our board members. We should speak transparently about who suffers the most in our district when they contract COVID. Pacific Islanders die at 6 to 7 times the Caucasian population. The Latinx population dies at 3 to 4 times the rate. The Black population dies at 2 times the rate. We have been begged by doctors at the School of Public Health to consider this data and the effect of COVID on our minority majority population. We should be responsible about the actual people who suffer the most from COVID, and our decisions should reflect that real data. We need to discuss what sort of illness and death is acceptable to us if we decide to send our kids back to school. If teachers, another thing we need to talk about, if teachers need to be remote for legitimate reasons, how can that be managed? I would rather allow our teachers to be remote in high schools and in elementary schools, but in high school specifically, since we're talking about that, than lose them to FMLA. Could we have parapros? If we have teachers with legitimate reasons to stay remote, then could we have parapros or others checking in on their classes while they're in person, if we go in person? We need to discuss why we have so many extended classrooms if we're prioritizing remote learning. I'd like to hear teachers and parents' opinions about those extended classrooms that they've been slotted into. We've seen that they're difficult for teachers, and we have seen that they're less effective for remote students. They also do not prioritize remote learning. And then we also need to talk about why we might be requiring, or some schools might be requiring, teachers who are teaching remote classes to come to school. We shouldn't require them to come to school if they don't want to. If they want to, that's fine, but it just increases the risk of transmission. I support every remote teacher teaching from home if they choose to do so. And if necessary, we should vote on this policy. So those are some of my questions and some of my thoughts about this matter.
Thank you, Catherine. Nate, go ahead.
Yeah, I'll pass in the interest of time.
Okay, Mohammed.
Nate, man, you're killing me, brother. Okay, I just want to first thank Superintendent Larry for all the hard work you've been doing. I can only imagine the sleepless night you might have had, and I'm sure your commander-in-chief is asking you, okay, you better retire. I do not want to see you there anymore. And also I'd like to thank every single person out here that's been putting so much effort in trying to come up with a healthy decision, trying to think of students and teachers and families, you know, and that's one thing that you unite us as a group over here this evening. Because I personally have been losing sleep over this. But I've been losing sleep over this because of my passion. So at this point, you know, I also would like to, you know, express our sincere condolences to Eddie's family. It was, you know, a great loss for our district, a great loss for our community, and a great loss mostly for his family. And I can only imagine the pain they may be going through. And I hope to God that none of us here will be going through that. It is rough. It really is rough to have a loved one, you know, leave, and you know you're never gonna see their face physically again. And it is rough. That's all I can say about that. And so to the students, we have so many different levels of issues that we are dealing with here. Students who are bullied, I'm sure they are, happy to be home and be safe. Students who are, behind in school, I feel your pain. I'm a parent and I have 3 kids online. And for students who are excelling, online, I commend you for that. And also for all of these students, I commend their parents for the effort and energy they put in every single day to make sure that they are on top of their education. And not only that, to make sure also that they are emotionally healthy as much as possible. And for teachers, we have a divided line here. We have teachers who wants to go, and there are some teachers who do not want to go. And of course, there is no silver lining in here. It is not an easy decision. It is a rough decision indeed. And I know for a fact that every member out here does in fact think about the safety of the teachers, the safety of students, and the safety of their parents. I'm telling you this because I have been here for a couple of weeks now or so, and I have witnessed it. And I just want to let everyone who is listening to know about that. And in regards to families, this has been a an eye opener to me, in a way that both those who want their kids to go back to school is because they love their kids and they want them to do well at school, and the parents who want their kids to be home and safe because also they love their kids and want them to be safe. I am talking here as a parent who I can't wait until my kids get back to school. It is one, I'm going to have a bit more time to put it into school board. My kids are so excited when time comes to go back to school. But at the same time also, as a parent, I'm concerned for their health, and I want to make sure they are safe and their teachers are safe. You see, so it is like I am placed in the part where all day I woke up this morning, I had a decision in my mind. As through the day, as I am listening, as I am reading, and getting in contact with people that I know, and so my mind started to really, should I say made me confused? I shall not say so. All it's telling me is that there is so much that takes place out there that is not, visible to the clear eye. And that's what I have noticed. And so for families who want their kids to go back to school, I absolutely, I can only say that you want that because you love your kids and you want them to be the best students, the best future leaders. And for parents who want their kids to be at home, I know why you're doing that as well. You're doing that for their safety, that's one. And two, you're doing that as well because you want their teachers to be safe and the family to be safe. And also, I shall not deny the fact that it is a challenging experience to have kids at home. It's been emotionally rough on families with kids who are like behind in school. It's been emotionally rough on families who both of them have to work and the kids are at home. And they do not know how the kids can be taken care of. And it's been rough on very hardworking communities where both parents and will have to work anywhere from 12 to 16 hours a day. And they have to still make sure that their kids are taken care of. And possibly they do not even have time and the kids fall behind. My heart breaks, when I hear about kids falling behind in school. The reason I say so, because these kids, since they were little, they were encouraged, they were taught, they were told stories about the excitement of going back to school and so. And now that there is a virtual and there is not a teacher personally there to mentor them, it's very hard, really, really hard. And for families, for all of you, my heart is very full. When I came to this country, I came because I have a dream to live the American dream. And I would not be where I am right now if it was not for education. I would not be where I am right now if it was not for the advice of my father when he said, son, here is $400 to start your life in America. And here is a watch, so you will know where you spend your time and how you spend your time. And those words have resonated with me since then. Please, to everyone here, whatever the decision might be, to all of you that are listening, whatever the decision might be, just know one thing, that everyone here cares for you, your families, your children, communities, and so. There are so many hard things to explain. Our schools, we want teachers to be safe. We want our schools to be safe. Also, we want in the long term, our schools to be successful. We do not want to pull a rag from under our schools and then we will suffer, 5 months down the road because of whatever action we've taken. We owe it to our communities. I could make a decision right now that will benefit the short term, or I could make a decision right now that will benefit us within a year or 5 years down the road. And I look further. That's where I'm looking, my friends. That's where I'm looking, families. I want us to pave a path, and I am here, and I really want to thank everyone for everything that you have done. It has been a rough year. US has surpassed 400,000, deaths, and we are at almost 24 million cases. Utah, we are at 326,000 cases and 1,507 deaths. And Salt Lake City is number one when it comes to, 123,000 cases, and we have 627 deaths in Salt Lake City. And I'm a firm believer that because of the action of the current board members and the previous board members, those numbers are low. If we did not take a solid action, I promise you our numbers would not be where they are right now. And so I hope that we're all gonna be taking, proper action as we go. And again, thank you everyone, and look forward to this being done.
Thank you, Mohammed. I'll take just a few minutes in the rotation as my turn following you, Mohammed. I appreciate the comments of all my fellow board members, and I appreciate the superintendent putting together this proposal, which is based on data and science. I've appreciated that the superintendent has always taken a very cautious approach, as has this board, to how to protect our community and how to from the virus, but also how to educate children safely. I think that there is a lot of information that Board Member Kennedy presented. A lot of it is anecdotal and a lot of it is based on fear. I think we need to look at what our local health officials are telling us is possible and think about how we can make that work and be solution oriented for our children. I am going to support the superintendent's proposal with the timeline he has attached to it. I think it is a step in the right direction for finding a path forward that balances everything that you've heard my very thoughtful board members talk about up until this point. So that's all I have to say, and I'll now defer to Christy for your time.
Thank you so much. I just want to thank my fellow board members. It's been a great conversation. Superintendent, I have some very specific questions for you. So first off, I just want to thank our district for how aggressive they've been and the information that they've been sending out about the vaccines. And so would you just walk us through that so it could be in our public record of what the district has been doing as far as emails, age groups, and how you think that's going over the next couple of weeks? Could you touch on that first?
Yeah, I think it's, so like I said, Sam Quantz set it up. There are emails that go out to age groups. We got down to 50-year-olds last week, and then we're starting, I believe, at 54-year-olds this week because some folks deferred for a week, but they are automatically just put back in the queue. So Sam's done really kind of a brilliant job of automating the system. So when a person gets this email, they can click on a link and then they can make their choices whether they want to go to Highland or West, and then they choose a time slot. And we can only do so many people. I think the nurses were able to do, oh gosh, I want to say, I can't remember the exact number, but a certain number of shots in a certain amount of time. And there were enough nursing tables to do this over this time period. So that's how it's set up. And then they also automatically, when they do this, it sets up their appointment for 4 weeks away for the second dose. So that's already in place. And those doses, which this is what the health department verified with us this morning, that those doses, while they are not in hand, they are already promised by the federal government that those doses will come. And so, and then when someone goes, the process is relatively easy. There's a short form that they fill out while they're waiting in line. Then they go wait. Everyone's socially distanced. They go in. They get the shot. They're given a little piece of paper when they're given the shot that that is kind of their it's their like their return note and tells them the date and time that they'll come back for their next shot. And then then they go to a holding spot. So then every person that gets vaccinated stayed on site with a nurse for 15 minutes to see if there was any reactions. I know there were some people that did have some reactions to the vaccine, but they are with a healthcare professional before they're released to go home. So that was the process.
Okay, so I know that, and I really appreciate you bringing up the deferment. So I know that there's many employees that I've actually talked to that have deferred to frontline, our frontline workers, which of course is mostly, our teachers, our administrators, and then, our child nutrition people. So I really appreciated, that opportunity to defer those shots until, especially when you fall into that age group, you have that option to do that. Yeah. My understanding is the district doesn't necessarily know what all the risk factors are that an employee has. So let's say that they're a younger employee, but they have risk factors. What is the process that they should do in order to be bumped up into getting a vaccine if they have risk factors?
We don't have a process for them to bump up. This is what all the districts in the county have done, is they've gone straight by age group. And so what has happened, though, is, some people have deferred. We haven't encouraged anyone to defer. I think that's a really personal choice. There's a lot of reasons to do it or not do it. And so we have allowed people to do that with the idea of we want to move down through the ages quicker.
That makes sense. Thank you so much. I think that will be helpful to a lot of the emails that I got about the vaccines. So thank you.
Yeah, I know there were a lot of questions after the first week.
Okay. Could you talk a little bit about what your expectation is for small groups going forward in our high schools?
Well, I expect that they should increase. I mean, we'll have people in the buildings then, right? And so right now, there's no guarantee on how many teachers are actually in the building, and so there's a limiting factor certainly there. So I would expect them to expand, but I don't have any details on that right now. We've been working really closely with the administrators. We did with all of this all of this information that I presented today. But we didn't talk about small groups over the last week or so.
Okay. I think, to the credit of Becky Pittham and her group, I appreciated the attention that they've paid to the small groups. I know that everybody's not quite there, but I think that, knowing that if kids are going to be in the building, for 2 days a week, that on maybe those other 3 days, there could be some small groups that are being held. So I think there's probably thoughtful conversations that are going on about that. But I think it just definitely needs to be a strong message, again, from us, to everybody, that we want to see that happen as safely, whenever possible.
Yeah. I would just add one slight correction to that is there wouldn't be 3 other days for small groups. It would still be the asynchronous Wednesday, because
that's right.
There would be teaching one group on one day and one group on the other day, intentionally to cut in half right away. This is assuming no one stays entirely remote, which we expect that a fair number will. And I would encourage anyone that's inclined to do that. It'll decrease the numbers even more.
No, thank you for that clarification. I'm glad that you said that, because absolutely you're right. Could you maybe talk about what a scenario would look like in order for us to increase from 2 days to 4 days? What do you think would need to happen in order for that to happen for our high school students?
I think it'd have to go really well. I can't, if I tell you that answer to that question right now, it'll change. So I think what we have is the option to get back with 2 days, and it would be an easy change. There would not require anything structural or big planning to switch from 2 days to 4 days. But I think we want to ease into this. I mean, we like you said, we've been cautious, and I think we want to be cautious in this. I mean, I think it's time to offer an in-person option for those that need it, but I think we also want to maintain a cautious approach to that.
I really appreciate your honesty with that answer, because I think you're absolutely right. I mean, we would like it, to move that way, but it's going to change. We don't know what it's going to look like, but at least, what your proposal is tonight is to start us in that motion forward. So I appreciate that. I think just in my closing, I would just ask my fellow board members, to take a look at some of our other high schools, some of our other districts with high schools that are similar to us. I will give you an example. If you go to Canyons District, they have a really great dashboard for their COVID information. And Canyons is really close, to the same amount of kids that we have. On the average, they have about 2,000 kids in each of their high schools. And I believe that they've got 6 high schools. So you can see what their COVID numbers are. You can see what's happening. They've been in school, since August. But I think it would be good for us, to look at what's happening in those other districts, that are in school, that have, more kids in school than what we're even talking about, because they've got all 2,000 kids at their school 4 days a week. And that's not what the superintendent is proposing here. So I appreciate, just the open and honest conversation that we're having. I also just want to address a comment that was made tonight. I think it's important, especially for my precinct to know, and for my fellow board members to know, that it's not just privileged people who want their kids back in school. I have multiple conversations and multiple examples of lots of families that are struggling, that are not privileged, that, have one income that's coming in. I had a letter from a mom the other day who's recently widowed and has 3 children, and she's just trying to figure out how to do all of this. So I think that it's not just about privileged people wanting their children to be back in school, and especially when I look at my precinct, and I've told all of you this, that it's a very divided precinct. And so I need to be able, to represent both sides of that. So I appreciate the open and honest, platform that we have tonight to look at this. Thank you, Superintendent, for, always approaching things cautiously. One of the things all of us have always said, and even before our 3 new board members came on, that the vaccine was a game changer for us. And it is. And I think that, if there's any way that we can always, advocate for, for those vaccines to be, in the arms to the people that are in the classroom sooner, that's what we want. I think all of us want that. And so I appreciate the efforts that have been going on. And thank you also to Yandri Chatwin for, being relentless with those emails, and also, through Sam Quantz, doing all of that appointments. So thank you so much. And lastly, I just want to thank everybody that has just been so engaged and, so appreciate all of the effort, that's gone into these conversations, because they're not easy. There's never a right answer. And I hope that we can take what we've learned this past week, that we really do need to work together in order to keep our district moving forward. So thank you again.
I need to thank you for your correction too. I should have included Yandri when I mentioned Mindy and Sam. She was an integral part of that as well in those communications.
All right. Finally, Dottie.
Thanks, Ms. Ford. Well, I would just agree with pretty much everything that's been said. I would say that I know that there are a lot of students that would really love to go back to school, myself included. I really miss a lot of the things that I used to be able to do. But I also want to make sure that our district goes back feeling safe and comfortable with the decision that we're making. So to that end, I know that the CDC has released those new guidelines on secondary education, which I think was kind of mentioned in the presentation, if I'm correct. But I know that one of those things stipulates that all of the precautionary requirements need to be met to their fullest potential, meaning distance learning, having masks, and all those mitigation strategies, which I'm sure you guys are more aware of than I am. But one other thing that I wanted to talk about is testing. I think Board Member Kennedy had stated this in previous meetings, is that testing is really a game changer, and we still don't have that option right now. And so I think there are other various strategies to test populations under limited testing availability, like pooled testing strategies. That's my biology IA, in case anyone was wondering. But so I think we just need to look to further strategies. The other thing I kind of want to question is that we are still engaging in high risk activities like close contact sports. And when we spoke with Dr. Hirsch, he said that, oh, it's good for students' mental health and well-being. I'm one of the students that does not play sports at a school. I'm one of the several thousand students that does not play sports at a school. And so I think that it's important that we're looking forward to the goal of getting students back in person. And that means that we focus on low risk activities and not prioritize high risk activities at the expense of other students. So I think that's pretty much what I wanted to say. Also out of obligation, I wanted to say that I know that there's no commenting available on the YouTube live stream. We're a district of shared governance. I hope that we can show the world what that means. I know that public comment is the bare minimum, but as a district, we've always gone above and beyond. So let's show everyone what it means to set the precedent for other students to be heard in a form of shared governance. Thank you.
Thanks for your comments, Dottie.
President Ford, may I have the floor and take up my time, please? From when I pass it.
Sure.
Okay, thank you. I'll be brief. So I appreciate all the comments that have been made from my fellow board members, and also wanted to extend a huge thanks to everybody, all of my colleagues on the board, the superintendent, all of his cabinet members, Yandri, everybody, that is working to, fulfill the promise, right, of why we chose to enter education, or why we chose to run for office, to be a school board member. I don't take this work lightly by any means, and I have been, privileged to sit and work with such fine people on this board prior to the change that happened in January, and to welcome in 3 new stellar board members as well. Foremost, I just want to say that I have the utmost respect and trust in Superintendent Madden, and I will be supporting his plan tonight as it's written. That's hard for me to say. I'm not gonna sugarcoat that. I have been in the middle on a lot of this. I've been to an extreme on a lot of this, and I've evolved into certain aspects of this as we move forward, as more information has become available, as more data has become available, and certainly as a vaccine has become available. I think there's a narrative out there that what we're doing tonight is sending every single student back into our schools. That's not the narrative, right? I need folks in this community to know that this is about choice, right? If you're a parent, if you're a family, if you're a student who wants that choice, that is your choice to do that. If this passes, that is your choice, and also your obligation to assess the risks associated with that. Please don't take those risks lightly. Please make sure that if this does pass, and if you do find yourself in a classroom, that it's not going to look the same. Sitting in a classroom in plexiglass with your mask on, socially distancing, it's not the same environment that you experienced in February up until March of last year, when we were asked to close our schools on a state level. Even though we maintain that abundance of caution, I do not believe at this point that this district or this board with this proposal is moving away from an abundance of caution. I think we've added an extra layer of mitigation. To Board Member Kennedy's point, there is transmission that happens in schools. That transmission is a lot less if we follow the rules, if we're masked, if we wash our hands, if we distance, and if we also make sure that we're maintaining those practices outside of the classroom in the community. I can't stress that enough. For parents, Board Member Mohammed let us know this too, right? If you want to maintain safety for your family, for your children, you also have that choice to maintain a stellar remote option like you have throughout this school year. Again, while maintaining very strict guidelines and protocols and processes in the community and in your homes. This is hard. This is something that I've characterized as having a bad and a worse decision. The hard part about this is that we don't know which decision is what, right? So we were very specifically and strategically going to have to monitor how this works moving forward. And again, I put that trust as an elected official through my obligation as a board member, and the superintendent and his team, our principals, our teachers, all of our support staff that work in our buildings. I think that that's important for me to say, because I have been a voice of caution throughout this entire experience, and it has not been. So I just wanted to say that, and would also like to present a formal motion, President Ford, if you're willing to accept one.
Yes, go ahead. To move this to action.
Certainly, I would like to make a motion that we move Superintendent Madden's secondary proposal as written to the action agenda.
Do I have a second?
Point of order.
Second. Oh,
Point of
sorry.
order, President Ford. I don't think we can do that since we voted on this very thing last week. And I think that until we have that rescinded properly with Robert's Rules of Order, we cannot move it to a board vote or to action.
This topic is on the agenda as discussion. The board by a majority vote can move it to action.
But not if we voted on the same proposal last week. So we voted on a return to February 8th last board meeting. So unless it is rescinded by our board, then we can't do that. By the people who voted against it, voted and supported the vote, the majority vote last time.
If we can still move this to action because it's on the agenda, on the action agenda tonight. That's my understanding from Robert's Rules of Order and from our discussion over the weekend. I would take support from our board attorney, board members who were in that discussion. I think we just need to move it to action by just the topic of secondary in-person option to action by motion, by majority vote. I have a motion and a second. Christy, go ahead.
So I'm not really clear what Catherine's talking about. And you know that the last one that this isn't the same recommendation that the superintendent made. And I guess, you know, if we need to have a parliamentarian step in, that's my understanding also, is that it can be moved to action and then a discussion there and a vote taken.
I guess what
I could be wrong, but
the point of order is that you're not allowed. This happened to us also in December, but the board members that are in the minority or any group under Robert's Rules of Order are not allowed to bring the same thing up again and again for more votes after they've lost. And so it takes the rescinding of that by people who voted for it last time in order to bring that up again.
Thank you for the point of order, Catherine. The chair gets to decide on the point of order. This is a new proposal brought by the superintendent. It's his proposal, and it's up to the board to decide if they want to take action on it. So that point of order is not accepted. We have a motion to
Point of order,
move this
can we hear
section.
from the board attorney? Can we hear from our board attorney, please?
Yes. If he's still on the call. Patrick, are you still on the call?
Yes, I'm still on the call. Yeah, my understanding of the parliamentary procedure that would be related to the same proposal. My understanding of this is described as it is not the same proposal, it's on the same topic, so that would not be something that would need to be rescinded before it could be voted on.
Thank you, Patrick. Let's go ahead and vote on the motion unless there's discussion to move this to action. Okay, go ahead and vote.
Huile, yes.
Are we voting on the superintendent proposal?
Just to move it to action.
Oh, just to move it to action. Okay, yes.
Catherine Kennedy, no.
Nate Salazar, yes.
Mohammed, I think you're muted.
Mohammed, yes.
Okay, Melissa Ford, yes.
Christy Sweat, yes.
Okay, we'll move that to the action agenda. If the board is willing, we can take that action up now. Board members, how do you feel about taking action now?
I would like to take action if we can follow what Anne kind of helped us.
Absolutely.
Which is
absolutely.
a 3 minute. So we all take one turn, but we have a 3 minute limit on what we say. And then of course you can go another round with that same limit, but it's all focused on, especially what we learned from Anne, which is really following the parliamentary procedures.
Yes, I have those procedures in front of me, and I would like to follow them. And the chair accepts that proposal that we limit conversation to 3 minutes, with everybody having a turn as we go around the table. Do I have a motion on this action?
President Ford, I move that we accept Superintendent Madden's plan as written in this evening's meeting.
Do I have a second?
I second.
Okay, that's motioned by Nate and seconded by Jenny. And the motion is we move to accept Superintendent Madden's proposal as it is written and presented to the board. Discussion to the motion.
So
Go
I
ahead,
guess
Hillel.
I can start, and then I'll
If you'd like to.
And I'll put my time for myself especially. But if you want to delegate that for me so that I do it for everybody else, I can totally do it. I have a timer.
That would, thank you. Yes, if you will time yourself and then time others.
Okay. So I'm starting. So I want to say I support it based on how it is because of my questions were answered, and especially of how the process was to get us here. I personally would have liked it if it was just like a week after, because of the timeline, just would have been moved there. But I think we would have enough of the teachers being vaccinated for us to move forward in that way. You know, to me, it's about back again to the choice, and you don't have to make that choice to go in person, which I think I heard a lot of students saying they don't want to, if we're talking about secondary. The elementary school aspect really helped me understand just the precautions in that level. And then of course, there's a lot of work that needs to happen. So I don't want to really make an official amendment on it, but if Larry, you can really listen to that, these suggestions of testing is so important. If we can figure out how the testing is going to happen, especially on site, this is going to make that even more. So I don't really feel like I need to make an amendment. If that's just kind of more of a directive, like making sure that you give us a report, just like you gave us for the elementary level thing, having a report of what that is specifically once we get closer, but a real clear plan of the testing and how it goes hand in hand with that, so that when anything and if anything happens, we need to go back to just like the other schools going closing certain things. But I think the option needs to happen. This experiment needs to happen, and we'll learn. And I think it's going to be important. And I think we've done the best of the precautions. Just like Christy mentioned, 4 days would be amazing, but let's start with 2. Let's see how that works. Let's work on it. You know, there's only 4 months left in this year. We have a good time to test this out. And but again, like kind of general directive, Larry, please help us understand the testing aspects so that we can, I personally could feel more comfortable with that, and especially more statistics about how many teachers have had it, what's the timeline of that. But I will be, you know, I'll be approving this based on the time that we have. And so I had 45 seconds left, but I will yield my time.
Thank you, Hoeli. Jenny, go ahead. 3 minutes, and you've got a timekeeper in Hoeli.
All right, I'm starting. I just want to, thank everybody on this board, administrators, educators, faculty, students, parents, everybody who's been engaged and involved in what has been taking place for the past few months. As I came into this board, I think maybe I didn't voice it enough, but my whole idea was for us to be unified, hope for the board to become unified in some way, some form sooner than later, and also parents, students. And I believe that the superintendent has done his best to make that happen. I've ultimately for choice. I've always been for choice, and I don't know how to reiterate it or articulate how important that is. I do also support the superintendent's proposal. I believe that everyone has done their best. They haven't taken anything lightly. They have done their research. They have, went to more than arm's length to get things, safe and, return safely back to school. And I don't want to, discount or belittle their efforts, because what I feel tonight that they've done plenty. They've done a lot, and I appreciate everything that they have done. So I know that there are people who are on the far right who don't want to return, who are on the far left who would want to return. And I believe the best option right now is what the superintendent has proposed. That is the most compromise. I feel that everybody will win-win. I understand that it's not going to be accommodating for a lot of people, but I think for the benefit of us to move forward and to test it out, because we haven't had an opportunity to do so. Allow these students a choice to choose, and let's see what unfolds. And of course, I think there are proper protocols in place to, if something happens, we're ready. I think we're ready right away to take precautions and hold back. But I am also in for support for Superintendent Mannon. Thank you.
Well, you had 30 seconds. Logistically, if you have a minute left, I'm just going to go like this so you can kind of get a feel. Okay.
Okay, I'm going to go for another 30 seconds.
Thank you. Catherine, go ahead if you want to speak to this motion.
You're muted, Catherine.
You muted.
I'd like to say that parents will have a choice, but most of our teachers will not have a choice. And teachers will not be fully vaccinated. If we get 300 doses a week, about half of our teachers will have received their first vaccine by February 8th. So half of our teachers will not have received, half of our teachers will not have received a vaccine. We have good plans for distancing and PPE. I agree with that. But of course, so do the other districts whose numbers are soaring way higher than ours. You know, those are statistics and data that we can't deny. I mean, that's happening. We can just take a look at the county webpage to take a look at that. Our experiment, our quote unquote experiment, is going to end in illness and possibly death, and probably death. The students will be transporting the disease to their families, and that will continue. We'll see our numbers go up. We'll see the numbers in Salt Lake City go up. And I'd also, again, like to hear how important the lawsuit and the legislature is in our decision making. I mean, how much influence did that have on our board leadership and on our superintendent? I think that it's that we shouldn't be bullied into making decisions that are bad for our population, for our teachers, for our students, and for their families. And that's all I'll say right now.
All right, thanks, Catherine. Nate, your turn.
Certainly. Thank you, President Ford. I don't know if I really need to restate anything that I stated ahead of time. And so this is a message that I delivered back in July, right? So, when we started the remote option, I pleaded with this community to rally around our kids. And I know I haven't been a shining example of what it means to be a citizen of the utmost decency and respect. I've been called out in the media for some things that I wish that had never happened. Okay, I get that. But the truth of the matter is relative to rallying around our kids, I question if that has been the priority for a lot of people in this community. The priority has to be our children, regardless of where you fit in the spectrum of how you feel COVID has impacted your life or how you believe it could or it couldn't. It needs to stop. I'm serious about this. We're talking about our kids, right? There are real life implications that Board Member Kennedy brings to the table, but there are also great opportunities like you've heard from other board members tonight as well. The scrutiny needs to stop. And relative to pressures from the legislature or the lawsuit, when I say I trust the superintendent, I mean that. And I believe it when he says that he wouldn't make this proposal if he didn't feel good about it, or if he wouldn't make this proposal if he didn't think it's something that we could do. I'm sorry if I put words in your mouth, Superintendent, but I feel like I've heard you say that enough throughout this process. That for me as a board member making my judgments throughout this entire process since March through July, and even up until tonight, legislative pressure is the last thing on my mind. The number one thing on my mind is making sure that we're protecting our teachers, that we get them vaccinated, and that we take a cautious approach until we get that second vaccine put into place. I still would encourage this district, not a scrutiny by any means, but we've talked a lot about putting out a statement. We've talked a lot about starting a campaign relative to what it means to be safe and follow guidelines and best practices relative to COVID-19. I truly believe that as we gear up for next week and for potentially February 8th, that we start that campaign and that this community comes together to rally around our kids. I'm going to make that plea again. We need to rally around our children and our students, not only for their well-being, not only for their educational outcomes, but we also need to make sure that we are following best practices to protect all of our stakeholders in this, which includes our teachers, our board members, our cabinet, and the community at large. And I believe that we can do that if we move forward with an abundance of caution and if we move forward with the common goal that we're doing this for our kids. I will yield my time.
Mohammed.
Okay, my timer started. Um, First of all, thank you everyone here for, being so united and so, respectful to each other. This speaks quality and the beauty of our board as members. Thank you. And so, we do have a divided community, parents who want their kids to go to school and parents who do not. And we are given this option here. You choose which direction to go. It is not, 100% what everyone would like to, but know that sometimes we are not going to be able to get everything that we want to all at once. We need to be able to accept what we have, work around it, learn from it, and make it better. And so as a parent, I do want my kids to go back to school. And as a parent, I am going to be doing my part to make sure that I'm also, keeping my family healthy out here so that when my kids go to school, they're not going to pass it to others. So to everyone that is listening, as parents, instead of like us just, disagreeing about this or that, the one thing that each one of us can do is make sure that you take care of your family, make sure you have your kids be safe when they are out. That way, when they go to school, they are not spreading it. Just follow the CDC guidelines. CDC guidelines will lead us actually to something better. And so with that said, I am in support of the plan, and I have great hope for it. We have to learn so we can move forward. And there is the only way for us. And
Thank you, Mohammed. My turn. I'll take less than my 3 minutes. I've already expressed my support for this plan and for the superintendent. As he's presented it, I would like to also just take a moment to express my, just the difficulty of this whole situation with the pandemic. It's been unprecedented, and that's a word that kind of gets overused in this day and time, but it really can't be overstated. And I appreciate every conversation I've had. It's informed the position I feel like I'm in tonight. And I feel very strongly that the focus of our district should be on providing the best educational opportunities for every student in every classroom every day. And that includes giving choice to parents and having them be a part of the stakeholder group for that. This isn't easy. It isn't a clear-cut decision, but I do feel like the superintendent has presented a plan that is an attempt at balancing the many different needs of our district, and I appreciate him for that. And so I will be voting in support of this motion to accept the superintendent's proposal. Christy?
Thank you. So I want to throw my support behind what Joelle said, is that I think that if there's a way, Superintendent, for us to get going on the testing at our school sites, that would be so important. And so whatever we can do with Dr. Hirsch, with the HERO program, and any other partnering that we can do, to get the testing. So thank you, Joelle, for bringing that up, because I think that is super important. I also want to say that my stance has never changed. Whether, it doesn't matter to me about the lawsuit or the legislature, that, I have been speaking from my heart and to the truth that I know for months now. So for me, that's where my vote stands tonight. I really didn't take the opportunity to tell Paul Schulte, I think he's left now, just how much I appreciate the heroic things that they've been doing in our schools to make sure that everyone's going to be safe. And I just really appreciate our facilities people and what a great job they've done. I also want to thank Mohammed and Nate for, again, talking about something we have been talking about, that now as we turn this corner, that it is going to be up to our community, our parents, our educators, the whole Salt Lake City school district family to come together and keep our schools as clean as we possibly can. And that means that we all need to do all of the things that we know we should do, which is social distancing, try not to gather, with people outside of your own home, that we wash our hands, we wear our masks, we do all of those things in order to keep our kids in school. So I appreciate, Superintendent, the amount of time that you've taken, with this and with the cabinet and all the conversations that have gone on with it. And I, like everyone else, am in support of the recommendation that you're making tonight. Thank you.
Thank you. Thank you, board members, for your thoughtful comments. We have a motion and a second on the table.
Dati would like to speak, though.
Okay, that's great, Dati. I'd love to have you speak to this.
Okay, I'll just go really quick. I'll use less than the 3 minutes, I promise. Okay, well, I just want to say that in regards to the public awareness campaign, I just want everyone to know that the numbers we're seeing right now are not what they have to be. The United States makes up 5% of the world population, but 20% of the COVID cases. That's so obviously disproportionate, and it tells me that we should be doing a lot better than what we're doing right now. And so I think there's several places that we can place that blame, but I hope that the community steps up and not at the expense of other teenagers and other students like me. And any other teenagers who are out and about, please keep your peers in mind, your own parents as well. And I hope that the Utah government also steps up to the plate and comes out to bat for our district, and make sure that we can lower those positivity numbers, because if not, then I really don't see this working as a long-term goal. The second thing is I want to just back up what I said on testing. I think that's very important. I know that the HERO project said that we probably have around 500 tests available per week. That's where I think pooled testing could come into play because of that limited number that we have right now. And the last thing I wanted to say is that we set out to reopen schools with certain goals in mind, which is to raise GPAs and to make sure mental health services are up and running, and to help students who are failing classes and who are unable to be reached by the district right now, to make sure that they are, all those goals are being achieved. So I think all those goals should be achieved if we're doing this in-person option. We need to make sure those students are being reached, because if they're not the ones coming back, then we're not really solving what we set out to. Okay, and thank you, Superintendent Madden. I wish I could give you a hug. I know how much work you've been doing. And thanks for everyone else who's worked on everything. You guys are all really great. I'm really happy to be here.
Thank you, Dati. Let's go ahead and vote on the motion on the table. The motion is I move that we accept Superintendent Madden's proposal as written and presented in tonight's meeting. Motion was made by Nate and seconded by Jenny. Let's go ahead and vote on the motion.
Are you doing a roll call vote?
I'll do a roll call vote.
Okay. So Huele, yes.
Jenny Sika, yes.
Catherine Kennedy, no.
Nate Salazar, yes.
Mohammed, yes.
Melissa Ford, yes.
Christy Sweat, yes.
Okay, that motion passes. Thank you, board members, for your participation.
President
We will
Ford,
now.
may I suggest a 5-minute brain break? I'm sorry, I know it's late. I could really use it.
It's late. We have a couple items left on the agenda. I will take board support for a 5-minute break. Thumbs up. Okay, well, let's reconvene at 10:38. Thank you. Okay, we're reconvening in about a minute. Just want to give everybody a heads up. All right, welcome back, everyone. It's 10:38. We have 2 items left on our discussion agenda. So let's move through this. Do I have everybody back? There we go. Okay, now I can see everybody. Dottie, are you back with us? Just make sure the board is all here. The next item on our agenda is the RDA policy. And this has been a process that's been shepherded by Christina Kindle. So I'm gonna let you speak to it. Christina, are you prepared to do that?
Well, I can speak to it.
Sorry to put you on the spot.
No, it's fine. So this is something that former board member Samuel Hansen requested. He provided a draft administrative procedures to for the policy subcommittee to look at, as well as some other resources. I believe at the last board meeting in which this was discussed, I was given direction to work with the superintendent as well as the business administrator in coming up with administrative procedures. So I used as a draft template what former board member Hansen had provided. I looked at the resources he had given us, as well as some similar policies across the state. I looked across the country. Those aren't really necessarily particularly helpful, as each state has different laws regarding RDAs, but I did look at those. So I came up with the draft document. I sent it to the policy subcommittee that was in its prior makeup. So that would have been Vice President Salazar and board member Kennedy and former board member Tuitupo. And I didn't actually receive any feedback from the policy subcommittee, but I know the direction was to put it on the agenda. So I, at least the policy subcommittee had it, and it's on the agenda for just discussion, as it's a new, it's tied to a new policy. And definitely, I should say that the business administrator Kearsley looked it over, as well as interim superintendent Madden, and they all gave the thumbs up to it before I even submitted it to the subcommittee.
Thank you. Does any member of the policy committee, I guess that would be Catherine and Nate, want to speak to it?
I'm happy to. I mean, personally, I think it's a great, document and a great policy. Ms. Kindle, thank you for putting it together. I only had one just minor, just point of clarification and potential change in section 3A. It mentions housing stock. And I'm just wondering if the board and our policy subcommittee would be amenable to adding affordable housing stock for families. I feel like that's been a charge and a desire of the previous board. And I see some head nods from current and new board members. And I just wanted to open that up for a potential option or discussion for this policy tonight. If that needs to be kicked back to the subcommittee, or if this board can adopt that tonight. Otherwise, I'm quite happy with the way it's written.
I would just add to what Nate says, that we've heard about this policy. We discussed this policy for quite a while. And as the person that served on the policy committee last year, I really appreciate all the input from everyone in the process. Thank you very much. And I hope we can go ahead. I think we could probably just amend that, add that one word and vote on it tonight. So I move, unless there's,
I want to just make sure there's no other discussion first from board members. Thank you, Catherine. I appreciate that. Go ahead, Christy.
I just want to thank the committee and Ms. Kindle for this policy. It's clear and concise, and I think it will provide this board, as well as any future board, really great guidelines. I'd also like to say, just as a personal note, that as I looked through the APs, that there's a lot that's in there that previous board members and boards, along with our previous superintendents and business administrators in our district, that we actually followed, you know, in order to do some of that redevelopment over the years. So having it laid out like this is looks really good to me. And I just want to thank the committee again for the good work that they've done. And I agree with what Catherine said, just changing that one little word. We can do that in an amendment and move this on after everyone else has spoken.
Any other comments? Okay, seeing none, I would accept a proposal to move this item to the action agenda.
Catherine, is it okay if I make that motion, or do you want to?
That you go ahead to move it to the action agenda. That's great.
Okay, I move that, I motion that we move the RDA policy to our action agenda.
Second.
Okay. It's been motioned by Christy and seconded by Catherine. Let's go ahead and vote on the motion to move this to action by roll call.
President Ford,
Yep.
President Ford, may I ask that we make an amendment to the motion to add the affordable housing stock for families?
Thanks, Nate.
Action.
We'll do that when we get to action.
Understood. I rescind the.
Thank you.
So roll call. So yes.
Jenny, yes.
Catherine Kennedy, yes.
Nate Salazar, yes.
Mohammed, yes.
Melissa Ford, yes.
Christy Sweat, yes.
Okay, so that's moved to the action agenda. How do board members feel about taking action on it now? Okay, let's go ahead and take action on the RDA policy now. I will accept a motion on the RDA policy. Jenny, your mic's off. Do you want to make that motion, or Catherine, do you want to go ahead?
I move that we accept the RDA policy with the amendment made by board member Salazar.
The motion, okay, I've got a, Nate, I didn't hear your motion.
Oh, I just was seconding the motion.
Okay, I thought I heard that. So we've got a motion from Catherine and a second from Nate. And the motion is that we adopt the RDA policy with the amended language to say affordable housing stock. Any discussion to the motion?
A point of clarification, President Ford, affordable housing stock for families.
Okay. So the motion, let me restate. We accept the RDA policy with the amended language of affordable housing stock for families. Any discussion to the motion? Seeing none, let's do a roll call vote.
Huile, yes.
Jenny Sika, yes.
Catherine Kennedy, yes.
Nate Salazar, yes.
Mohammed, yes.
Melissa Ford, yes.
Christy Sweat, yes.
All right. Thank you, board members. Moving to the board committee item on the discussion agenda. We talked about this at our last board meeting. I took input and feedback from board members. I sent it out to you for feedback. I received just a little bit of feedback. It's attached to the agenda as I sent it to you, with an opportunity for us to discuss any changes tonight. And I know that there will be some. I'm expecting a few changes. I think that that's good. I want this document to reflect what the board wants in terms of how we serve on committees and represent the board on the committees on which we serve. So I also would like to have a discussion, as you probably noticed, on the draft I sent to you. I didn't include the negotiation committee because it is something that I felt like we needed to discuss based on some feedback I received from the superintendent and the human resource services director, that with the important work of that committee, we maybe needed to have a discussion about how it was constituted. And so that's something that I'm bringing to the board tonight to discuss these committees. So you've got the draft in front of you that I sent to you. It was my attempt to reflect your desires on how you would serve. Let's go ahead and discuss. Try and keep it to just a couple minutes per board member for discussion. Go ahead, Hawali.
For me personally, since we all get one chance to talk before we get to talk again, but for me, I'm good with where I'm at. So I'm good with that. That's all I'll say.
Okay. Thank you. Christy?
Thank you so much. I am too, with the exception that my intention with the recreation board is to move Mohammed into that position. So have him come to a couple of board meetings, over the next, because they have him every other month, Mohammed, but to have him be the new representative for the recreation board. We can bring that back to you in the next couple of months.
Okay, that sounds great. Thanks, Christy. Other comments? Catherine?
So I was surprised to be on the Human Sexuality Education and Maturation Committee. I have been on that committee before. I think it's a great committee. I really enjoy being on it. Unfortunately, it meets regularly during a time when I have an SCC meeting, and they've established that meeting that the time when they meet is the same time that they've done for years and years. So I was surprised to be put on that because I didn't ask to be put on that. I wouldn't mind being on that committee, but I can't go to that meeting regularly, which is why I had to ask to be removed from that committee before. And I asked about, maybe a year ago, and I did communicate that with you, Melissa, as well. I also would love to continue on the SLEF board. I've done it before, and I'd like to continue there if I can. It's a meaningful thing, and I feel like I know the people well that are on that board.
Thanks for that feedback, Catherine, and my apologies about the human sexuality. Nobody had requested it on that in our last meeting, and I put you there, and you did tell me after that the reason you couldn't be there was because of a conflict with an SEC, and I know you're very dedicated to attending those SECs. I appreciate that. I wanted to put it out to the whole board, however, to give them an opportunity to step into that position. It is a good committee, as Board Member Kennedy says. It's an opportunity to review materials that our students see in their maturation programs, and they're good community members, and we have good district leadership for that. So board members, if you have an interest and a willingness to serve on that, I would like to hear that now.
You have to put up with me apparently though, so keep that in mind.
You do have to put up with Nate.
does it require two or just it requires one? Just a point of inquiry.
So it doesn't require two. It's had two. That's my understanding. We don't have to have two members there.
I'll volunteer so that Nate is not alone there. And plus, I used to be a health teacher, so that's up my alley. So.
Right, a social worker and a health teacher. I think we'll be in good shape.
Okay, thank you. Thank you, Huel, for volunteering. I will put you there. And then I would like to address, Catherine, your request to be on the SLEF board. I had a couple board members who requested it. I also know from our previous board committees that I've looked at that's been a position that the board president has attended the SLEF board. So I would like to be able to continue as the board president to be the representative on the SLEF board and give the opportunity to a couple new board members to rotate into that position as a board committee. But we'll take discussion about that. And then let me see, I need to hear from Mohammed and Jenny and Nate on committees.
President Ford, I'm good with where I'm situated in these committees.
Okay.
The same here, Mohammed. I'm good where I'm situated.
Okay. Jenny?
You could 1, 2, 3, 7.
You're on a lot. You're on a lot, but you signed up for a lot. And
I did.
And I would suggest that might be an opportunity for you to, if you'd like to step off the SLF board committee and allow Catherine to be there because she'd like to continue there. I don't want to necessarily pressure you to do that, but in the purpose of this discussion, that might be something you could consider.
Okay.
And I
And
don't
if
want
you-
to pressure you either, Jenny. If you want to be
Yeah.
on the school board, I respect that. That's fine.
Okay. Yeah, I think I did request this left board, but the other ones I don't recall requesting. Like the traffic, you could remove me from the traffic.
Yes, you're funny. I did take notes, but yes, I'm happy to. Like we've talked about, we don't have to have multiple board members on these committees,
Okay.
but we can. So
yeah, I'm okay where I'm at. Let's leave it at that. Yeah.
you want to keep the committee assignments you have?
Yeah, I'm good.
Okay. All right. Any other discussion to these committee assignments? Okay, now I'd like to discuss as a board how we would like to move forward with the negotiations committee. It was something that we started for the first time last year, and something that I'd first of all maybe like to make sure the board is wanting to pursue, which I believe we are. If there's different discussion to that, then let me know. That committee had 3 board members on it last time, board president, board vice president, and so myself and Nate and Sam Hansen. I'd like to recommend that the committee going forward be a board leadership committee with 1 additional board member, and that keeps some continuity. It also gets new board members an opportunity to be able to participate. That's only a recommendation. I would like discussion from the board on how they would like to handle that negotiation committee. The recommendation comes through our Human Resources Services Coordinator, just hoping for some continuity in that committee. Again, doesn't need to be board leadership. I'm not telling you what it has to be. I just want to reflect that desire that there be some continuity on the committee and experience. So I will open the floor for the board members to discuss this. I would like to hear your thoughts. Hoel Lee.
I am not interested, well, at this time, but I just want to recall that I do remember some of the board members being interested. So I just wanted to show that I remember people wanting this committee. And so that's just, but I'm not interested at this time. But I do remember Mohammed maybe saying that he was interested, and I kind of pointed out that he has, a master's in HR. So.
Yes, I think many board members expressed interest on being on the committee. But yes, I didn't have you, Hoel Lee, as somebody who is interested, but I know you probably will be in the future. Just knowing that this is a new thing we're setting up, I do think it's important for us to set some process and some guidelines for it. But I'm speaking out of turn. So board members, go ahead. I want to hear what you have to think about it.
Can I go?
Yes.
How long do you serve on that committee, or like, what's the time? Your whole term?
As it's a new committee, we haven't set that standard yet. So there's value to doing it, for 2 years, I think.
Yeah. I like the idea to rotate. I'm okay to sit out on this round, but I'm interested in the negotiation committee.
Okay, and okay, go ahead. I'll defer till everybody has a chance to speak. Christy?
So I think that it would be a good, I mean, this is going to be just my own thoughts about this. Obviously, as a board, we need to decide. I think that when we started this committee, the intention was to rotate. And I understand, what Ms. Orton, is suggesting, that there be some continuity, with, and where you and Vice President Salazar, our board leadership for the next 2 years, and then putting that third seat, in a rotation. And so I think that for me, I would like to put my name in for the third seat, to be a part of that. But I do think it needs to be on a yearly basis, so that during those rotations, we would all have an opportunity to serve on it. Right now, I'm sitting on the policy, and, policy is going to take some time, but my other 3 commitments, are ones that I can manage easily. And so I feel like that being able to be on the negotiations team, I'd be able to give it, my attention and the time that it needs.
Catherine?
Yes, I also would like to put my name in. Also, I would like to remind the board of the discussion we had when we established the negotiations committee. It wasn't with the new members, so I think the new members should be able to weigh in. But what we talked about is that we would have the 3 people on, and then that we would rotate. Christy and I would rotate on this time. So I think that we could have a stability with 1 member of the leadership team. I think that would be great, whichever one that you prefer. Nate was on last time, but I think that we don't need both members of the leadership team on the committee. And like I said, I just want to remind the board of our discussion that we had. We set up the negotiations committee last time.
Nate, go ahead.
Yeah, thank you, President Ford. I think I'm just hearing a lot of different scenarios about how this could play out, and knowing that there was a desire for the board to have a discussion from district employees relative to how we constitute this particular and new committee as a practice that we haven't traditionally done, at least in the recent era. I would like to suggest that perhaps we, being that negotiations won't be taking place for a number of months, that we take the appropriate time necessary to constitute, set out guidelines relative to membership, length of term, in coordination with our experts in the Human Resources Department and negotiating team from the district side of things. And would like to suggest that we bring this up at the next meeting with a little more clarity and direction from our district employees.
Thanks, Nate. Mohammed, do you want to speak to this negotiation committee?
I agree with Nate Salazar. It appears like there are so many loose ends that still need to be tied. So that's going to be our best option, is to push it until we have some more details.
Okay. What I'm hearing is that we will create a 3-member negotiations committee that will have 1, potentially 2 of members of board leadership, and a yearly rotation of 1, potentially 2 other board members. But that we move this to an agenda when we can have our Human Resource Services Director here and present a proposal, and we can discuss it further. Does that sound? I'll share that conversation with her with the superintendent, and we'll work on getting that on an upcoming agenda. I would go ahead, Hoali.
But I move that we take to action just the committees, not the negotiation one, but the other committees we established with all those edits that we just had before, to action.
Okay. I'll second that. Any discussion to moving it to action? Okay, let's go ahead and vote. Nate, do you have a question?
I do have a question, just as a point of clarification and not speaking out of turn. Just wondering, President Ford, if you could state the changes that we've discussed tonight, or if you feel like we can manage that. I think the only thing that I'm nervous about is I think there's a couple of these committee meetings that are happening towards the end of the month that we won't be able to decide upon at our next meeting, that we might miss. if we're not super clear about who's on what committee, because I think there's a few changes. I guess none that are super consequential, but just wanted to make that point. Melissa, you're muted.
Sorry about that. The notes that I have on committees, setting aside the conversation about the negotiation committee to a future meeting, would be putting Hoali on the human sexuality maturation committee. And that's the only change I have.
I think the other change I took was removing board member Sika from traffic. And I'm not sure if we made a specific decision about the SLEF board yet.
Okay, we can discuss that.
But then again, we're also just moving this to action, so we could take that up in it as well.
So Jenny, maybe you could clarify. I felt like you were originally thinking about being off traffic and SLEF, but you then said you wanted to stay on them both.
That's correct. Yeah, I decided to just go ahead and leave it the way it is. Everything that you have on the report that you've given us, that I'm okay with it.
Okay. So the only change would be taking board member Kennedy off the human sexuality and putting board member Organista on. And we're just moving that committee assignment list to action. That's all we're doing at this point, is moving the list as it is to action. Let's go ahead and vote by roll call.
Hule, yes.
Jenny Sika, yes.
Catherine Kennedy, yes.
Nate Salazar.
Mohammed, yes.
Melissa Ford, yes.
Christy Sweat, yes.
Okay, so that's now moved to action. On the action agenda, the only thing left then is the board committee assignments. I'll take a motion on board committee assignments.
I make a motion to accept the committee assignments with the edit of removing board member Kennedy and adding me, board member Organista, on the sexuality and maturation committee.
I'll second.
So the motion on the table is that we accept the committee assignments as presented, with the change of adding board member Organista to the Human Sexuality Maturation Committee. Any discussion to that motion? All right, seeing none, let's go ahead and vote.
Hule, yes.
Jenny Sika, yes.
Catherine Kennedy, yes.
You're muted, Nate.
Nate Salazar, yes.
Mohammed, yes.
Melissa Ford, yes.
Christy Sweat, yes.
Okay. Thank you for that. Now we'll go ahead and move to the next portion of our agenda, which is board member reports if needed. We'll go ahead around the table if board members have things that they want to report. Okay, I have a couple of things I'd like to share with you. An update on our superintendent search. Just as an update, I got an email this evening from our search consultants, Ray and Associates, to let me know that we ended up with 33 completed applications. Very strong national showing from the following states: Washington, New Mexico, Utah, Texas, Wisconsin, Kentucky, New Hampshire, New Jersey, Minnesota, Illinois, Dakota, Virginia, Colorado, Florida, Kansas, New York, Tennessee, Iowa, and Georgia. Ray and Associates has begun screening and vetting and will begin checking references for those listed and those that are not throughout this week and early next week. let me remind board members that we have a scheduled meeting on, scheduled potential meetings, January 28th through 30th to screen applications. They're using and we will be using the input received from our stakeholder meetings and from the work that we've done together as a board to create that those qualities that we're looking for in our next superintendent.
Melissa, let me ask you a question. Will that be
Absolutely.
the first time that we'll be able to see the names of the candidates? Will be on the 28th and not before then? Do you know?
I actually don't know that. We've talked about us seeing those applications all together at the same time. So I'm assuming that that'll be the first time. I don't want to, I want us all to have access to that same
at the same time.
Mm-hmm.
Okay. And then I'm assuming that, well, maybe we would talk about this, but are we going to try and, are we Zooming that meeting with them? Are you wanting us to be down to the district altogether? I mean, what would be the preference? I think that since we're not meeting again before we have that meeting with them, maybe we could talk about that. I don't know, maybe you could send out something to us because it's not really a part of our discussion. It's not on our agenda tonight,
right.
But I would like to know, what that is going to look like that day. Thanks so much. So
okay.
An email would be fine.
I'll send an email. Thank you. Mohammed?
So I know we talked about soliciting for someone to help us with the screening. How are we going about that, and who are we thinking about?
So, as far as someone to help us, we have Ray and Associates who's helping us with that. So that's the consultant firm.
No, sorry. Like when we get the the applications, we are ready to kind of like decide who we're going to be interviewing. I know we did talk about having someone from the city that come and help us. Do we know how we're going to go about that?
So that's a conversation for the board and superintendent, if you could maybe Hoeli, you could pull up your infographic and we can talk about, well, that's not on our agenda. So let's not talk about that now. What we do need to talk about in that next meeting is how we get our next round of community input. So we will leave that to that next discussion where it's noticed. Thank you for the question. We do need to take a few minutes to have a closed executive session at the end of this meeting. We do closed executive sessions if necessary by board vote. Go ahead, Catherine. You have a question?
I'm sorry, I wanted to know, so we're taking the 25th off our schedule because we had that scheduled, is that correct?
Let me pull that up. I think what we talked about was the 28th, 29th, and 30th. We had tentatively held the 25th, but we, in our last meeting, voted on the 28th, 29th, and 30th.
Okay. I just request that we take, we either start at 4 or later. Are we planning on doing the whole day on the 28th and the 29th, or we take a break from 3 to 4? Because I've got meetings on both of those days from 3 to 4.
So the recommendation and the reason we set aside 3 days was so that we could have some flexibility on timing. So let's work on that by email, but send me your meeting times and we'll work around them. It's probably with 33 applications, the screen going to take some time. So let's work on finding the right time to do that.
Okay.
All right. I would like to take a motion that we first, while we're still in this open meeting, that we go into a closed executive session, both for the purpose of discussing litigation and character and competence of personnel.
President, before we do that, I just wanted to see if Superintendent Madden reported.
Yes, Thank you, Nate, for keeping me on task. It's getting late, and I apologize.
I do not have-
Superintendent, do you have something you'd like to share?
No, I don't have anything else to share today.
Thank you.
Thanks, Nate. I appreciate that.
I can make the motion, Melissa. I move that we go into closed executive session for the purpose of litigation, negotiations, and property and character, professional competence, or physical mental health of an individual, or deployment of security personnel, devices, or systems at 11:13 on January 19th, 2021.
Second.
Any discussion to that? Let's go ahead and vote.
Jole, yes.
Jenny Sika, yes.
Catherine Kennedy, yes.
Nate Salazar, yes.
Mohammed, yes.
Melissa Ford, yes.
Christy Sweat, yes.
Okay. For the purposes of this meeting, thank you all for your time. Oh, Dottie, sorry, Dottie, did you have something you want to say before we adjourn?
No,
Go
I was
ahead.
just gonna
I'm
wait.
sorry, Dottie.
I was just waving bye. That's all. I was just waving
Okay.
bye.
Thanks, Dottie.
Thank you for sticking with us all night. I really appreciate you. Okay, this meeting is now